Everybody drinks. Everybody goes to pubs, and you don't tell them that, do you?
I do. I tell everybody.
I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully.
There, that's where your penis is. That's where you breathe from, and that's where Dr. is showing you.
Exactly.
Oh, dear.
This is just this morning.
I've got liver cancer, not brain cancer. You know, I can still function, and I want to do that. Every day's precious.
Good morning, Pediatric. Iris speaking.
Yeah. I'm just trying to see who else does it.
And your name?
Who else does that thing for you? I'm trying to see which other doctor does it.
Hello. Sorry, I've kept you waiting too long.
It's all right.
How are things?
It's peculiar what happened. I was stung on my arm by a wasp that came in through the window.
OK. So when was this?
It was a couple of days ago. I couldn't move my arm. It swelled up, and then it felt achy all the time. It's still funny, my arm. I don't know whether it's because I'm a funny woman.
Do you want to show me where the wasp stung you? Do you want a hand? There we go. You got that one?
It sort of swelled up there, and it still prickles or something and aches.
Well, nothing's hot or red or angry.
It aches still.
Now, what's happening with the psoriasis? Have you been going to see the dermatology nurses?
I haven't because I've been too busy.
Because they were supposed to see you, weren't they, in the daycare so that they could do your creams for you. It's still quite bad on your elbows, isn't it?
It will go. It doesn't hurt.
What's stopping you from going to see the nurses?
It's because I'm tired. I get tired. I can't sleep at night. I lie awake. We're moving.
Yeah.
And it's awful.
What's happening with your sister?
She's going to the country.
OK.
Retirement home.
And have you found anywhere that you're going to live?
No, I can't find anywhere.
As GPs, we're always taught that we should ask open questions and let patients tell their story, but it can be really difficult when patients bombard you with lots of different pieces of information at once. In a 10-minute consultation, that's really difficult.
So are you wanting to buy something then?
I want to buy a flat for the rest of my life. I'll be on my own with my cat, that's all. My sister doesn't want me anymore.
Oh. So did you ever think about going with her, or do you want to stay in Putney?
I want to be near Morley College, where I give concerts and I play Beethoven, Chopin, Brahms, Rachmaninoff. And I played all my life since I was 5 years old.
OK.
Music keeps you young. It kept me young. My father died of a heart attack in the hospital. I just visited him and he said, good luck for your concert. And it was sad, really.
No, it is.
He said, be happy when you play. And he smiled, that's all.
I'm falling apart, basically.
Right. Oh dear, okay.
The last 4 or 5 days, I think I had an ear infection. My ear was agony.
Right.
And also, I would like you to look up to see what progress they're making towards this hernia.
Right.
And the large cyst I found, and I've had enough.
Yeah.
Do you mind if I have a good look at all the joints on each side?
No, have a look at everything.
Pain when I'm pushing?
Yeah.
Up and down, does that cause pain? Okay.
Yeah.
Bet they fractured the bone in my groin
When?
when they done the angiogram.
Okay. All right. Where do we start?
You have to go in soon.
What?
You know, the doctor's going to look at your ear.
Okay.
Are you going to be a good boy and let him look?
Okay.
Are you going to be a good boy?
Yeah.
Hello.
Hello.
Yeah.
How are you?
I'm well, thank you.
Hey, Mommy.
Hello, Matthew.
Hi.
When did I see you last? That was a while ago.
Hey.
It was
It is a
quite
while
like
ago.
10. More like 10.
Yeah, 12 now already. He has got another ear infection, and I only noticed it yesterday evening when we were in church that he had a lot of gunk coming out of his ear. He won't let me touch it.
Right.
He insists that it doesn't hurt, but he quite often does that. I've never been able to be sure whether he's just got a very high pain threshold or whether his communication's a bit off around it.
Cough, cold, snuffly nose.
He's been very tired, but no, not really. No. And
Fever?
it's quite difficult with Matthew because he doesn't tend to develop particularly high temperatures.
No.
And quite often, you know, it's only when you see the evidence of something. I imagine this has probably been quite uncomfortable for him for some time, but it's only seems to be when there's some visible sign.
Can I just have a little look at your ear?
Yeah.
It's a bit of a mess, isn't it? You can't see it, though, can you?
He won't let me clean it or anything.
Can I just touch it with a stick?
Hi.
Yeah, not going to go inside, just on the outside. Get a little bit of that fluid. You look at Mummy for me.
Matthew, look at me.
That's good boy.
Look at me.
Ow, ow, ow.
Good boy, good boy, good boy, good boy, good boy, good boy. Ah, good boy.
Well done. Good boy, Matthew.
I like your jacket, Teresa.
Oh, do you? Well, you're not having it. I'm joking. I've seen you for a while.
No, we haven't. Have you been well this early?
Yeah, but did you like to get fun
So
one
yesterday, I read this. And it really frightened me when I read it.
Oh, really? OK, well, we can talk about that. With this, what scared you about it?
It scared you about people dying, you know, not surviving the operation and that.
Yeah. OK. Did you understand what it's talking about, this aortic aneurysm? Yeah. What did you understand by it?
Well, because my father had one.
Did he? You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot. Do you know if I've got one?
Hi, how can I help today?
So we just need to get a certificate of health from his modelling agency.
Let's have a look. She's going to be a superstar, is he? It's nice to see a well baby. I see lots of time seeing grizzly babies. Now, we'll have to ask at the desk whether or not sometimes these things don't technically come under NHS services and sometimes there's a fee.
Oh, yeah. No,
but I'll ask. Can I have a look at your tummy? Lovely. We'll just give you a little once over. Oh, let's have a little listen to your heart. Good boy. Look in your mouth. Good boy. Thank you.
Very good.
Magic. Magic. So what I'll do is, I've got no reason to be concerned at all. I will sign this and I will just put it in an envelope and ask you to speak to Nicola, who's currently on reception.
Okay.
Good luck with his stellar career.
Thank you.
Are you still smoking?
I still smoke consular, cool as a mountain stream.
How many a day?
About 10.
OK. Any thoughts about quitting?
What?
Do you want to stop?
Watch what?
Do you want to stop smoking?
Not particularly at the moment, I'm worried.
I mean, it may not be the right time for you to stop smoking now, but I think it would be important to do it when things are more settled. What about alcohol? Because alcohol can increase your risk of osteoporosis.
I'm trying to cut down.
That would be really important if you try and cut it down so that you're having less than 14
My sister, we
units.
both try and have half a bottle each.
Over what period of time?
On a night.
Half a bottle a night?
We have little small glasses. We fill, and she goes back again and fills.
But if you're having half a bottle every night, that's much
No,
more than...
she has her bottle. I have mine. They are small ones.
OK, but even if you're having... What, do you have the whole bottle?
No, we don't drink... No, we have she has a small glass and she fills it about that full.
Right.
Full.
What we recommend is that you don't have more than a bottle, if you're drinking wine, a bottle and a half a week.
Oh, everybody drinks. Everybody goes to pubs and you don't tell them that, do you?
I do. I tell everybody that they need to not drink more than the recommended amount. The other thing that you need to do is make sure that you're getting enough vitamin D and calcium in your diet.
Oh, I expect you're hungry, aren't you? Have you had your lunch?
I haven't, no. I've been busy.
Oh. Well, you must come to my flat when I buy a modern flat in Putney and have a meal. I'll cook for you.
Thank you.
Spicy cheese grilled.
OK.
And you put tomato puree, a bit of that, and you make an ordinary tasty thing, and you put few herbs in it, and then you grill it, the top of it.
Sounds good.
And put a gherkin on top.
OK. Right. The things that I'm going to do is, why don't we see each other in a few weeks, OK? And then you go and see the dermatologist tomorrow about the skin, OK?
Yeah. I better go.
All right.
Thank you very much.
And that's your time of the appointment, remember? So you take that. All right, so you go and see them tomorrow.
Thank you.
See you later.
What do doctors do when they finish at 12 but then start again at 5?
They either go home if they live close, or they do paperwork, like catch-up work.
This is Dr. Hassas from Putney Mead Surgery. Hi there, I had a message to give you a call, sir.
The work is endless.
I was expecting to see you this morning, I think, to check your blood pressure.
When we've finished seeing our patients, we've then got to type our own referrals, read all the letters coming back from the hospital. We need to check blood results, review people's repeat medications. The list is just goes on and on and on, and you never feel like you get to the end of your work.
Well, when did all the trouble start?
I tried to ring you yesterday, but you were unwell.
Just give me an idea how long this has been going on for.
Right.
Give me a rough idea.
OK, take care. Bye.
Yes.
So they haven't written to you because you've got one. They've written to you and thousands of other men of your age to see if you've got one. Did you understand what it's talking about, this aortic aneurysm?
No.
No. What we'll do, why don't we draw a picture? So, my drawing's very bad, all right? That's your body. OK. It's not a very good drawing. But your heart is here.
I think that's your legs, Richard.
Brilliant. Well done.
There, and there.
Yeah.
There, that's where your penis is. That's where you breathe from, and that's where Dr. is showing you.
Exactly, exactly. So, this bit here is called the aorta. And normally it's nice and straight like that, like a railway track. Sometimes it can swell up a bit like an orange, and it bulges out. And this is what is called an aortic aneurysm. What they've done is they've written to you to get you to have a scan that just looks at your aorta in your tummy. So it's not saying that you've got an aneurysm. It's not saying that you need an operation for it. You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot on the heart.
Okay.
Yeah.
He had an operation on an aneurysm, did
Yeah.
he? Did he? Okay. But just because he...
But he had a blood clot there.
Did he? Yeah.
So...
Yeah. After operation, sometimes people can get blood clots, unfortunately. But just because he had it, it doesn't mean you've got it. Richland trees, they have different needs from a lot of our population. From my point of view, I see my role as helping them negotiate the health service in order to use it effectively. Richard, they're not going to do any operations on you. What they're talking about doing is putting some jelly on and having a look. You know when pregnant women have their babies looked at?
I'll be with you.
Oh, is it the same thing?
It is, yeah.
Oh, right.
It's what's called an ultrasound scan. Okay.
It's
Pressure
nothing
off
to
that
do with
area.
your stomach, is it?
No, it's nothing to do with your tummy being big. Okay. Sometimes, if you're very thin, we can feel them, but I think you're a bit too big for us to feel it. I can try and feel it if you like, but it's quite hard to. If you've got a bit of fat on your tummy, we often can't feel it.
Doctor, don't say that. He's trying to lose a lot of weight, is he not, son?
I'm not overweight.
Yeah.
No, he says, it's, look, he's laughing.
I'm not laughing. But you know your tummy's bigger than mine, isn't it?
Yeah, but it's not that...
He does go to the gym a lot.
That's really good. And going to the gym helps stop things like this. Yeah, that's really helpful.
Can we give you some medicine?
Yeah.
You sure?
Yeah.
Okay, good. So, ear drops, have you had much success with over the years?
No.
No, okay.
Getting anywhere near his ears
Yeah,
is...
so I think, you know, the swab should just give us the bug and hopefully which antibiotics it might be sensitive to.
Mummy.
Aren't you?
Mummy.
You let the doctor look, didn't
Mummy.
you? Yes, Matthew.
Down.
Down?
No, down.
Dance?
Yeah.
Are you a good dancer?
He's
Are you?
addicted to Strictly Come Dancing at the moment.
Oh, I'm addicted to Strictly Come Dancing. Who's your favourite?
Oh, football.
Football?
Football?
Yeah.
So who's your team, Matthew?
Oh, Fulham.
Fulham?
Yeah.
Excellent.
Yeah. Oh, Fulham.
Fireworks, Kitty and fireworks.
Yeah.
Your favourites?
Yeah.
Fireworks night's coming up.
Yeah.
We went to see some fireworks last night, didn't we, Matthew?
We're going to watch some fireworks tonight.
No, I'm going to watch the FA Cup.
Oh, sorry. Got the wrong pastime.
Well, yeah, fireworks are for kids, aren't they?
Yeah.
Did you do anything for like fireworks last night?
No, I was too tired. And it was too cold.
Yeah, that's true actually.
I haven't been to a firework display.
You wouldn't believe what my brother's dog did. They were out. This is last year. A hole through the door. I'm not joking. It's terrible.
When did you get her?
She's 3 months now.
Really? And she's a hearing dog, is she?
Yeah.
No?
Yeah.
No.
She's an everything dog.
An everything dog.
Diabetic dog.
Okay.
So she needs a dog
Really?
to cover.
Yeah.
Very clever.
Brilliant.
Almost as clever as you. Have you got a dog?
No.
I
I don't want one. Okay.
Too pain.
What pain? Really? Tell me about it.
My heart. Because I walk in her all the time. It makes me twat. And the walking is there.
Are you getting it every time you walk her? Yeah. Will you take off your shoes and I'll have a look at your feet and your legs? Okay. Let's have a look. And is there any pain when I'm feeling your legs? Does that hurt?
Down the back.
Yeah. Okay. I can feel some veins there, but what we always wonder about is that we know your diabetes isn't very well controlled.
I'm on the wrong insulin. This is why I'm waiting for the referral to go and see the
And
PT.
I'll ask about that. That's fine.
I sat in an empty waiting room for over an hour. Right? I couldn't get out of the chair. I can't sit down for very long. Right? I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully. And when I said to him, why am I an hour late? And I did do that. Why am I an hour late? And we take a longer time because we care. I don't give a toss who you care about. Do you know what I mean?
Yeah. It can't be that people are upset by every interaction you have with our surgery. That's not fair.
The things that we do look for in moles, we have an ABCD rule. We look for any asymmetry of the mole, so anything that looks a little bit irregular, any change in the border of the mole. C would be for colour change, so if you're getting darker patches within the mole, then that's something to worry about. D is for diameter, anything that's more than about 6 millimetres. E for anything that's evolving, so anything that's itching, bleeding, anything that feels like it's changing, always come and get that checked out.
Yeah.
Okay. Have a good rest of the day.
Great, you too.
Take care.
Thank you.
Bye.
What were you thinking we might do about this pain?
Tramadol, actually.
Really? Just painkillers.
Yeah.
We can certainly go with painkillers, but we need to be cautious with you because you are at risk of getting problems with the blood supply to your legs. If you get any chest pain when you're walking, or if you're noticing that when you walk a certain distance you get pain in your legs that settles down when you're resting and then comes back when you start walking again, it's very important that we do get a vascular surgeon to see you to check on the blood supply to that area.
Does it look like it's got to reduce blood supply?
No, not significantly, but actually...
Don't tell me significantly. Does it, yes or no? If it was your foot, would you take it somewhere?
Part of my job is to manage risks. I know that you're at a high risk of having problems with your blood supply because of your diabetes, okay? So it's nice to want definite answers from doctors sometimes, but we can't always get them. It's not, is it?
No,
exactly.
It's just based on the opinion of the individual.
When you came last time...
Oh God,
Why do you say that?
I'm very flexible. I come here, all I come here for is to get my medicine.
Yeah. There's
don't wanna
flexibility on both sides.
Exactly.
All right? I'm very flexible with you,
Yeah,
okay?
you are.
What I would say is, doesn't matter what profession you work in, if someone shouts at you when you're trying to do a good job,
No,
it's
she was
terribly
talking-
upsetting.
Right. The reason why I knew that she was talking is that all your muscles here move when you speak, even if you don't move your lips.
I'm
am
sorry,
deaf.
you've obviously had
I
it.
am not stupid. I have an IQ of 156. You know, I don't want to be, and how are you today? I could just feel the hand patting my head. No, you don't talk to people.
All right, we'll leave
And
that.
this, you know what I feel about that.
Yeah. Do you know, when I see you, do you know probably on average how much time I spend with you?
I know.
Yeah.
I don't understand and yet I'm grateful for it.
These are just normal people. We're all normal people, but it just worries me the regularity of it. Abuse within the NHS is taken very seriously in every practice, but the aim isn't just to tell people off, it's to try and work out why they felt the need to react in that way. And usually you can work with people and find a way forward with them.
It was because I was so stressed. I will apologise to him.
Did you?
No, I will.
Okay.
But I will apologise. And
Let's,
as I
we'll
say,
finish now, all right. I'll get that
sorry.
I'll find out what's happening about that diabetes appointment. Come back and see me in a month.
Mum.
Yep. And we'll see how your legs are doing. Right.
I am sorry.
Do doctors get ill? Like,
Yeah.
like how? They're doctors. Can they just? It must be so weird being a doctor going to the doctor. I think I've had this conversation with you before.
How was your holiday?
Oh, it was lovely, thank you. Very nice. We went to Snowdonia and did some walking. Came back and got a bit ill again, unfortunately.
A doctor got ill?
Oh, yes, quite a bit.
Oh, that's no good. Are you better now?
A little bit, a little bit. I'm usually very well. Last time I was ill was the swine flu, so...
Don't go on holidays. It sounds fatal.
Hi, come on in. Right, so you're here for a refit of your implant.
Yeah.
Perfect. So, is this the first one that you've had in? Yeah, and you've been really happy with it as a method?
Perfect. Absolutely amazing. Couldn't ask for better. Yeah,
Brilliant.
really good.
And have you had any side effects from it?
Not at all. The first couple of months, I think I was told it has to regulate out.
And then you've just had no periods
Nothing.
for the last 2 and 40
it's been
years?
Perfect. And I suffered
Brilliant.
really badly with cramps and everything beforehand, and it's just completely eradicated the whole thing. I haven't had anything, so it's been great.
Fine. So it won't be painful at all. Taking it out can be a little bit fiddly.
Okay.
Because after 3 years, the body can put some fibrous tissue around it as a little sheath.
Yeah.
Are you happy to get on with it?
Yeah,
Is it
absolutely.
left or right arm?
Got it in here.
You've got it in your right arm.
just
Okay.
there.
Hopefully that will be straightforward to get out. So what we need to do, I pop you on here. So I'm just going to get everything ready on the trolley. The first thing I'm going to do is just do the local anaesthetic injection. Well done. And once this starts working, you won't feel anything else, I promise you. You will be able to feel me touching you,
But not pain.
but you won't be able to feel pain. Okay. So, can you feel anything? Wow. Just releasing the little capsule that I talked about that can form around it.
Okay.
It's out.
Really?
That's pretty quick.
Oh my goodness.
And I can put the next one in.
Okay.
And you will be done. Just put it on a little pathway just along the side of the original one.
Okay.
Done. Finished. That was really straightforward.
I'm
You did
glad.
really well. And this will last you another 3 years until you come and have your next one in.
Come in. Hi there. Mr. Gomez. Hello, sir. Come on in.
You don't know about me, do you?
No, it's the first time we've met, so no, I don't.
I've been a patient here for a long time. And I've discovered that I had cancer, liver cancer, a couple of months ago, but it's very bad. It's beyond surgery, so I'm going in towards, I think, the end of this month for the chemo. It's going to be a chemo Christmas.
Right.
I live alone, and I'm really struggling with the pain of this. It's extremely painful. It's those I'm taking. They're supposed to be every 4 hours, but I can take them every 1 hour, up to 1 hour if I want them. So I'm taking them every 1 to 2 hours.
Okay.
Sometimes I take them 3 and on the trot, 1 hour on the trot.
3
and
in a
then
row.
something, but I try not to because I don't want to build up too much tolerance. Because when I get to the end of all this, I'm going to, I'm going to end up taking buckets of it, and I don't want to do that. I've been in so much pain for the last couple of months.
And where is your pain at the moment?
Oh, it's all in this region
On the
here.
side of the liver. Okay.
Yeah, it's all in that region just there.
Okay.
I can't do anything like cooking, getting up, and the other thing is, look, it's my legs. This is all like water. She said it's water.
It does look like water tight, isn't it?
My feet are like loaves of bread. I can barely get my shoes on.
And sometimes when you have problems with your liver, the amount of protein in the blood drops, and then the fluid is just leaking out into the cells, and that's where you get the swelling. So the idea, I think, probably behind the chemotherapy and all of those things is to reverse some of those side effects of the liver problems.
It's, I don't know, you know, I don't know. See, I'm on my own. I'm taking care of myself.
Right.
So it's very, very difficult, you know.
Yeah. Have you got any other support around?
At the moment, that kind of support, I don't want that support, you know.
What kind of support?
You know, like coming around and cooking for me, cleaning for me, doing it. I want to do that myself until I can't do it again. I've got liver cancer, not brain cancer. You know, you know, I can still function, and I want to do that. Every day's precious. I don't want to give it up. I don't want to give up responsibility. I want to go down to the shop and get a loaf of bread.
Yeah.
You know, I want to touch it before I buy it. You know, is it fresh? You know what I mean? And I want to do these things still, and I don't want to take that away from me yet.
No.
You know, that's all I've got really. You know, the little things in life, which are the valuable things in life.
Precious.
You know, just take the dog for a walk on Wimbledon Common with the boy. You know, there's lovely little precious things. And but you can't do it if you're in agony.
How long were you in hospital for?
2 weeks.
2 weeks,
Yeah. They took me in. They said, "Oh, your bowel's ruptured." Basically, I've been walking around with a ruptured bowel for God knows how long.
And how are you managing now that you are home?
I'm okay. My belly's a bit of a mess.
Okay.
And I've got a bit of a hole here.
Okay.
I'm just worried about, because I wasn't told anything about Crohn's disease. I don't know what to eat, what not to eat.
When you've had part of your bowel removed, your bowel absorbs nutrients, and so depending on what part of your bowel has gone, you know, you need to make sure, you know, that you're getting all the nutrition.
Hungry all the time. Is that normal?
It can be. It's a big thing for your body to go through, and your body will be working harder, helping to heal everything up, and your calorie demands will be higher. And how are you doing? A lot of people struggle at the beginning with just how it all feels and looks like. How are you?
I haven't got a colostomy.
Have you not?
No.
Oh, I thought you had a colostomy.
No, I just missed it.
Oh, I didn't know that.
Just missed it.
Wow, so they resected your bowel and then...
I'm really lucky, because I think I'd just die if I had to have one.
I thought you had a colostomy.
No,
okay.
That's why I'm worried about what I eat, because that surgery could happen again, and I don't want one.
No. You're doing an amazing job.
Thank you.
So far.
I don't have very long, and I don't know. I'm going through all kinds of negativities, you know.
About the chemotherapy?
Yeah. Once I'm in there, I'm wired up. That's it. They got me.
Part of my job as a GP, we deal with people who have terminal diagnoses, and it's always upsetting to be with someone who is going through those stages of life. You have to try and keep that emotion to yourself, and make this the interaction about them.
What are you worried about? What worries you? The agony of
it. This, I know.
The pain there.
I know what's coming. Yeah, I already know what's coming. I can feel it. But with the chemo, I can possibly push me up to a year, maybe beyond.
I'm always impressed by how people find resources within them to face the final days or weeks bravely.
I've got a severely disabled lad. He's blind. You know, I've been his sole carer for the last 16 years.
Right.
It's my son. Yeah.
Yeah.
And I need to prepare him because he's acquired brain damage. You know, he needs to be prepared for this one. You know, we protected him when his mum had cancer, and she died, and he was in a mess. You know, so now he's going to have no one there.
Does he have any carers or any?
Oh yeah.
He's got people around him.
Yeah, okay. He's with guide dogs. You know, he's got a guide. So, but
so there's all that worrying you.
Yeah.
As well,
His welfare. Yeah, his mental state. That's what worries me. Yeah.
And what kind of support, ideally, do you think he would benefit from?
Well, that's what I mean. I want about a year to sort of watch it. You know, to sort of, you know, I need a year to get him prepared and to be prepared to be on his own now.
Yeah.
You know, there's things I need to settle and take care of. Yeah.
If you have a think, and if there's anything else you think you need help with, or we might be able to help with, could you just give us a shout, and we can work it out.
Yeah.
I'll give you the amounts, more of these both.
Oh, the same again. Yeah.
Yeah. I'll give you a bigger volume.
Yeah.
so that it doesn't run out.
Because I need to get this under control.
Yeah.
The management,
So
the pain management. Yeah.
The pain we will get under control. The pain will get sorted. All right. Nice to see you. Give me a shout if there's anything else.
Thank you very
All
much.
right.
Thank you.
Take care now. Cheers. Bye bye.
Come in. Hello. How are you?
Okay.
You're wearing glasses. Oh dear.
This is just this morning. Sunday was kind of okay. It was a bit swelling underneath, and then this morning, swelling even more than this.
So it's got better throughout the day?
Yeah, a little bit. I did take an antihistamine in the morning.
And do you think the antihistamines made much of a difference?
Not really.
And then, is it very itchy?
It's not at the moment.
It's just very puffy and swollen, isn't it?
Yeah.
And you're not wearing any eye makeup or anything like that?
No.
Poor you.
I'm also concerned that, the flaky skin bit kind of seems a bit yellowy.
One of our doctors does have a special interest in skin. Let me see if my colleague's available, just to get a second opinion.
Is it just on your face?
The swelling is, yeah.
If we give you 2, so we give you the 1% hydrocortisone.
Yeah.
Use the stronger one for a couple of days.
Okay.
Just to get it down and get some of the swelling down.
Yeah.
You're going to have to moisturise well, because as soon as that swelling has gone down, you're going to go wrinkly.
Yeah, yeah.
Which is horrid. What job do you do?
I'm a teacher. I've got parents' evening tomorrow.
Oh dear.
Do you feel sort of anxious or worried?
I'm not sleeping very well at the moment. Which is very unusual for me. I wake up all the time.
I'm still not sleeping properly. I haven't gone back to work yet because I've got another certificate from another doctor.
Okay.
And I prefer to have another couple of weeks off so I can get my head together and think what I've got to do.
And the problem with sleeping, I don't get sleep at all. Maybe because of the stress, the workload, what I do, could be the reason. And tiredness is for the last 2-3 months. I'm really, really tired.
I mean, this kind of gives a good description in some ways of what you've been experiencing. You're finding it hard to kind of see the light side of life and not enjoying things as much as you used to.
That's been quite a stressful few months.
It has been a stressful few months. I can't get through the day. I'm kind of worried.
But small steps, because you've come a long way.
Hiya. Come through, Tony. How are you?
Well, thank you.
You look great. Like the trousers.
Thank you.
They're fab.
Back at uni, so...
Oh, right, OK. What course are you doing again?
English literature.
Right, yeah. I got a letter from Dr.
Ducci, yeah.
Yes. And you're on a waiting list for psychotherapy?
Yes, I'm currently seeing Dr. Healy at the Wandsworth Complex Needs every 3 or 4 weeks.
Right.
When I first found out I was diabetic, it definitely really threw my mental health, and I think I definitely wasn't coping for a period of 6 months, and I think I've got over that phase of, I think it's called burnout, when you stop testing and you stop really trying to look after it, and I think I'm testing 3-4 times a day now. I'm really trying to get a control of my blood sugar.
Yeah. Whenever a young person, particularly that has had a mental health problem, gets a diagnosis of type 1 diabetes, it's a very difficult combination. I haven't seen you when you're unwell with your mental health. And Dr. Ducci's indicated that you've had some really difficult times in the past.
I lost my mum when I was young, and I was initially born in South Africa, and now I'm at 15 social services intervened, so I've pretty much looked after myself since I was 15. So that's probably a lot of the issues. It was very early independence.
And were you very vulnerable at that time?
I think so. I think asking any 15, 16-year-old to look after themselves is a big thing, but I wouldn't have changed it because I'm here where I am now. And
brilliant.
Yeah.
I know from my experience of being a patient
how much courage it takes to come and sit in the chair of a patient. It would have been about 15 years ago. I had had an eating disorder throughout medical school, and it happened at a time when I was a single-handed GP running a practice on my own. I had 3 children under 5, and I was working very long hours with very little sleep. It was very difficult to sit in that doctor's chair day after day, year after year, telling people to look after themselves when I was crying out to be looked after myself. I think you're very self-aware and you're obviously resourceful, built self-reliance, but just let people in. As well. I went downhill pretty quickly until one day I could only get halfway to work and decided I couldn't do it anymore. And that's when we called our own GP and asked for help.
Is that everything?
Yeah, I think it is with me.
Yeah. Have a good day.
Thank you very much. Thank you. Bye, Tony. I've come through. I'm able to truly accept that illness is not your fault. And doctors are patients too sometimes.
Morning, Ebony.
Morning.
Leonie.
Oh my God.
I'm Susan Towers, a GP, but with an interest in skin problems, so that's why your doctor sent you here.
I hope you can help me.
So you didn't have any problems with your skin as a child?
On and off.
What did you have?
Patches of eczema, but then more recent, I've had outbreaks like all down my back, all down my legs, and the biggest problem is my ear. I've had that ongoing for over 12 months now, antibiotics, creams, steroids, anything, and it's just not helping.
Is there any reason why you can think that might have happened? Your job, for example, or any hobbies?
I'd say maybe stress-related. I think age thing, getting older.
You perhaps stress more because you know there's more to worry about, don't you, maybe?
Yes. I've had poor mental health, so I've just been getting myself more well.
Right.
So focusing on my mental health, going to support groups and stuff.
OK.
I've been using hydrocortisone ointment on my ear. It itches, so in the night I'm waking up and my ear's on fire, so that's what's been bothering me more lately. This is really bad.
Oh, that's nasty, isn't it? Do you colour your hair?
I have dyed it, but I haven't had hair dye in the ear.
It is leaching out slowly over time, that's why it fades, and so it can irritate you if you're sensitive. Can I look at, what did you say, your legs are bad?
What they are on my legs is more scars.
Let me pull this round.
Yeah. These are the recent ones that I've just scarred.
Okay.
I say they're like cigarette burns.
Yeah, you do have a spotty type of eczema, which some people have.
And these are my old scars.
Previous,
But this is why it's bothers me, because it's come back again. No, it's scarring me. I'm not sure if you can see if there's any on my back still, but normally I get them all over my back.
Oh, there is. Okie doke, thank you.
Come and take a seat. So this is a new chap, is it?
Yeah, we're engaged now.
OK, so you missed your appointment yesterday for your B12, is that right?
We got it wrong place, didn't we? We slipped up, didn't we?
Anyway, let's see when your last one was.
You won't know anything about diabetic, will you?
Hmm?
Do you?
Want to know, yes?
Oh, well, we've come to the right place.
Yeah. Well, I did my blood this morning and I was 17.7.
OK. What is it normally?
One day last week, it came up to 22.
Anything changed in your diet?
No.
You're not having more cakes, biscuits, chocolate, anything?
No, I've been
eating a few sweets, but...
I've been eating a few, but not a lot.
No.
He's telling tales on you.
I know. Because we go shopping and, oh, a bag of sweets goes in straight away.
I wonder who's putting the sweets in that...
Me.
OK. So just be careful with those.
Yeah, well...
Yeah.
Right.
OK, love, yeah.
Shall we do your B12?
Right.
Where do you normally have it?
Either my left or my right.
Do you think this injection now might bring a blood test down a bit?
This is not going to have anything to do with
ain't it?
glucose levels, no.
No.
So this is like iron deficiency.
Yeah. I
So
see.
she might get a bit more energy.
Yeah.
I could do
She's
with
full
some.
of energy.
Is she?
We go cycling.
Good.
I went cycling yesterday and I fell off on my bike. Look.
Oh, keep an eye on that.
Does it need out on it?
OK.
We're
but
putting Savlin on, aren't we?
If it gets more red, more hot, and any swollen, come back and get it checked. But
Yeah.
keep it clean.
Right.
Right, shall we do it in your right arm?
Right.
OK.
There goes.
So relax your arm down, OK? You know it stings a little bit, don't you, when it
Yeah,
goes in?
it does, yeah.
Look at you fella. Sharp scratch. It's all right, nearly done. All done. Okie doke.
Thank you very much.
Today. You're welcome. Nice to meet you.
Yeah, nice to meet you.
And you.
Oh, yeah. She's not just a pretty woman, eh, love?
We'll see you again, love.
See you later.
Right, bye, love.
Bye.
Your skin surface is supposed to be like a brick wall. With
Yeah.
the bricks are your skin cells and then the cement in between them. And people with eczema tend to not have quite as good cement as people who don't have eczema.
Okay.
That means the bricks fall off more easily, so your skin tends to be a bit drier and flakier.
Yeah.
You lose water through the gaps, but also things can get in. When something gets through those little cracks and irritates, it irritates you a lot more than it would irritate somebody without eczema.
Yeah.
And that's why steroids are needed, OK? Because they suppress the inflammation. But we don't want to keep using steroids because they're going to damage your skin.
Yeah.
That's why I've got to prevent with lots of moisturiser.
Is it common that? Because people think I've got flea bites and stuff. I've never seen it before.
Well, I've seen it like that. Some people do have a spotty type of eczema.
And why have I only just started getting it?
Stress always makes things worse. We know it affects your immune system.
Right.
Maybe when you weren't so well with your mental health, you didn't look after your skin as well as you do
true,
now. I don't know. It's a
Suppose,
combination of
yeah.
things usually. But anyway, now you've got to start.
Yeah,
again.
definitely. Better than you fobbing me off, really, because I was thinking it just weren't curable.
It's not curable, it's controllable.
Yeah. Lovely.
So you've got 2 tubs of moisturising cream, so that'll last you 2 weeks. I've given you this quite strong cream called Cinelar C. I've given you loads more than I think you'll need, actually. It should be loads better within a couple of weeks.
There's hope, isn't there?
There's definitely hope. You're going to get better.
Yeah,
promise.
thank you very much. Thank
You're welcome.
you.
We have a big problem with his willy with foreskin. Last couple of days he was complaining that it hurts.
Yeah.
And that he feels the pain when he doing wee. And yesterday at school he fell over and he squashed it somewhere. I've been asking him if it was hurting before he fell over.
Yeah.
He said yes, yes.
Yes, OK. Right, let me have a little look at you. Well done.
He come to me yesterday and tell me, Daddy, I have a little problem.
Oh.
Pull his pants down, look, he's swollen and bigger and getting bigger and bigger.
Poor thing. OK, so it's slightly up now. Right, over here onto this little
Chodź,
thing
pani
here,
sikorka,
all right,
obejrzy
sweetheart?
rybcia.
Over you come. There's a good boy. All right, then.
Oh, that side is worst.
Is it uncomfortable?
It is hurting.
It's hurting.
I think he squeezed somewhere here, or is it infection or
Okay.
something?
It does look a little bit infected, doesn't it?
Yeah.
I agree. I'd like just pop his things back up for a moment. I'm going to ask Dr. Keris to take a little look at him
Stand
because
in,
that's sort of, well, it's obviously tender, isn't it? All right, I won't be a moment.
Okay.
But it looks like bruised at the base of his peen, like really bruised.
Really?
Like, because they said it was really swollen up.
Okay.
And I thought that doesn't look normal.
Right.
So.
Okay, sure.
Right.
I got bitten by a dog
yesterday.
OK, right.
And he drew blood. And the police suggested that I come to see the doctor.
OK, so tell me what happened.
I'm walking down the road and there was this woman standing by the car, husband standing there and her son with a dog on the lead, a little rat on the lead, yeah?
OK, yeah.
Suddenly just jumped up and bit me through the leg.
Right.
But I was more shocked.
Yeah, of course.
I mean, I love dogs. I've had dogs all my life, but I've never, ever been bitten by one.
The vast majority of dogs are beautiful, nice animals, you know. Right, shall we have a look at it?
Yeah. I don't think I can get it out far enough.
It's all these new trendy pants that are all tight at the bottom.
Yeah, look. Oh, I might.
Right.
It actually hurts.
Yeah, I bet it does, because it's bled underneath as well, which is that bruising that you can see there.
That really hurts.
Right, there's a couple of things we need to do. Because he's broken the skin, we need to give you antibiotics.
Yeah.
Any bite that breaks the skin, we give antibiotics for.
Yeah.
We need to give you a tetanus booster as well.
I haven't had one of them for a long time.
Yeah,
Okay.
I need the top of your arm for that, so if you can just...
Take me jump.
Yeah. Are you allergic to anything?
Not that I know of.
So this will protect you against tetanus for the next 10 years. So
OK, thank you.
Right, just a sharp scratch, sorry. You're all done. That's
Thank you very much.
No problem. And a course of antibiotics to take for 7 days.
Yeah.
It's certainly not infected or anything now.
That's good.
It's just about protecting it from getting infected and protecting you from tetanus. 1 4 times a day for a week. That's you sorted.
Thank you very much.
All right, nice to see you.
And you. Thank you very much.
See you later.
Bye.
OK, I've got Dr Caris in to take a look
Hi.
at Philip as well. All right.
Right, so what's happened then today?
He got that problem with the foreskin.
Right, tell us a bit about it. What happened at school then?
I was running, then I fell down.
You fell down? Yeah. OK. Oh, did you land on someone's leg or someone's knee? Maybe. Yeah. We've got to make you feel a bit better, haven't we? Yeah, what do you reckon? Should we have a little look at you? Are you able to sit down? Right. Can you pull the skin back yourself? Is it going to go back? Show us what you can do. OK. Right, there's some bruising. Right, yeah, a little bit. OK. What year are you in at school then? What class are you in?
Year 1.
Year 1. So how many teachers have you got?
2.
2. Right, can I have a little look down here, see if we can make it feel a bit better? Yeah. You're a good lad, aren't you? Where is it most sore? It's just all over, isn't it?
It's hurting in here.
It's a bit swollen, isn't it? OK, you're such a brave boy. OK, did anybody kick you today?
Yeah.
Who kicked you? It's OK, you can tell us what really happened. It's absolutely fine.
Someone kicked me and then I fell over.
OK, where did they kick you? In this bit?
Yeah.
Pull your things up, OK. I think you're the bravest Year 1 boy I've seen today, definitely. Definitely. Right. I think probably he's been kicked there and that's flared things up a little bit and it's all a bit swollen and that's aggravated the problem. He has got a tight foreskin and he may well benefit from a circumcision at some point, you know, where they remove the foreskin to allow it a bit easier.
I'll do a referral and they can discuss it with you about whether to do it straight away, to wait and see.
You've been ace. Haven't you? Such a brave boy. Because he's able to pee, we think we probably need to give him some antibiotics to try and help settle that down. You may be more comfortable sitting in the bath and trying to pee in the bath, you know, things like that. Okay. Is that all right?
Thanks for the
all
help,
right,
yeah.
I'll leave you in very capable hands.
No, OK, thank you.
Any questions?
No, I think we know everything.
Yeah, there we go then.
All right, thank you.
Thank you. You're welcome.
Bye-bye.
Bye-bye.
All right, see you, bye.
OK then. Bye.
Irish Medical Practice, Dawn speaking. I'm afraid our system has crashed at the moment. We're not able to do anything. I think it would be the same at our other surgeries as well, yes, because we all use the same system. We are advising people if they could call back in about an hour or so. No, I'm afraid I can't do anything because none of the doctors can get onto the system either. I can't physically get onto the computer to see the appointment system. I would advise you ring 111. As I said to you, before the systems went down, I knew that all the appointments for this afternoon had been fully booked. I'm really sorry, but there's nothing I can do because there's no system. The only option would be to ring us in the morning to try and get an appointment then.
Dorina. Hiya. Come on down.
Bit faster. You know, I feel a bit...
You're still walking quickly enough, though, aren't you? Hey?
Do you know, Dave, I can't.
Yeah? What's been the matter?
My feet.
Yeah?
Here. When I put in the morning, put me here.
Yeah.
I feel like a sponge.
So is it tender?
Oh, yes. Even the painkiller doesn't kill it.
If I press there, is that where it's tender? Yeah. It probably is fasciitis where...
Yes.
It's where the arch drops a little bit.
Yes, but it's the other foot as well, just the same.
Yeah, it's often the same on both feet. Yeah. What commonly happens is if we look at your foot sideways on,
yeah,
that's your heel bone,
yeah,
and those are the bones going to your toes. You'll have this strong,
yes, there.
this strong tendon that goes along to form the arch of your foot. And what that tendon does, sometimes it flattens out and it pulls on the bone here, and it causes an inflammation of the tendon and around that heel bone. That's the thing that's painful. Yeah. What you can do is buy some supports that support the arch.
Oh, my son's bought me.
Yeah.
Two.
And the other thing you can do is you can give an injection to that area.
Oh, no. Then I shall try with that.
Do you want to try with that for another few weeks?
But you see how thing goes.
OK. So you were telling me last time about... Because when we're going down to see my son...
Yes, he's still down there,
in
isn't he?
Sevenoaks.
In Sevenoaks.
Yeah.
It's he used to be beautiful, but he wasn't very populated. I remember it was there. But it was beautiful, clean, part of the countryside.
And why were you down there again?
Because I had relation everywhere.
So you were a guest of Mary Soames, who was Winston Churchill's daughter.
First daughter.
And used to go and stay?
Yes, because Auntie, she was the top chef for them.
What year was this? Was it?
In 1954.
Yeah.
Because Winston used to say, oh, Bradford is very dark.
So we'll wait and see how you go with the padding.
Yes.
Another 3 or 4 weeks.
3 or 4 weeks.
Still struggling. We'll reconsider possible injection.
Well, I'll try anything.
Yeah? OK.
Thank you very much for everything. And you look after yourself.
And we'll see you again if you're struggling still with
this. I'm getting old. But no, not...
You're still great. Yeah.
Keep on going.
See you later, dear. Bye-bye.
Did you see me at when I was 14? And I thought I looked like a right stunner. I went to my sister's anniversary and she had the album out. That's what I thought to myself, oh, you looked pretty not bad.
Even though you say it yourself?
Even though I say it myself.
That tall, weren't you?
I know, I was actually tall-ish.
Oh, it still looks like you. You have changed a bit.
That's me, yeah. And then look at this.
Yeah, you still, I'm sorry, but you still look good. You were, what, 14 there?
Yeah.
Yeah, you should have seen me up when I was 14.
No, I can't imagine you being chubby at all.
Come on in, have a couple of seats. I'm Dr. Caris. Right, this is Angela, is it? Who have you got with you?
I'm an auntie.
Auntie Linda.
Yeah, they live with me and my husband.
All right.
Mum died.
All right, OK. Right, what's going on?
I can't struggle to breathing ever.
All right, OK. When did...
She's been on it for nearly 5 weeks now.
5 weeks, all right.
And she's got inhalers and she's using them, but they're not touching her.
Oh, really? Right. OK, so which inhalers have you got and which ones do you use?
I use that one at night and morning. And that one during the day when I need.
OK. Let's check you out then. Have you had your inhalers today?
Yeah.
And have you ever had trouble with your breathing before?
Yeah, but not as bad as
Not as bad as this. OK, all right. Right, let's pop this on one of your fingers, eh? And how do you feel in yourself now?
Just a bit breathless.
A bit breathless, yeah. Because your oxygen level's very good, 99, and your pulse rate is OK. Can we have a quick listen? Is that all right? Able to stand up, eh? I'm just going to have a little tap first, OK? Feel a bit warm, don't you? Okay. I'll just have a wee listen down here. Don't mind if I just... Okay, that's fine. Have a seat. So, I mean, listening to your breathing, it's very clear. There's no sign of any tightening or asthma there. Your numbers are very good, and clearly you're struggling a little bit. And I just wonder if that's more sort of an anxiety, panic attack type of thing rather than a flare-up of the asthma. Our brains control our body, as you know, but sometimes they can sort of go into override, if you like. And certain things, sometimes for unknown reasons, can start making us feel a bit edgy and a bit anxious. And I think that's probably what's going on. Has anything happened today at school, or that's maybe could have made you feel a bit anxious and things? No. Yeah, panic attacks, they are very common. Much more common in ladies for some reason. Much more common in sort of your sort of age group, if you like, and it maybe is because there's a lot of changes going on, but also there's a lot of sort of emotional stuff going on and difficult to manage sometimes. There's a phone number we can give you that you can ring, and you can get access to someone who can talk a bit about it. Would you like to do that? I think that's probably the best option, isn't it? All right, any questions from either of you?
Thank you.
All right. OK, we'll get you sorted, no worries. All right. See you later.
Come in. Hi, Mr. Arnott. Come in, I'm Dr. Khan. Come and sit down.
Nice to meet you.
How can I help?
So, Saturday, I went for a drink, went down to Tesco's, went to go buy some more beer. As I was down there, a group of lads ended up chasing me.
Right.
I must have done a good 5-6 miles of proper sprinting, running for my life kind of thing. I've really damaged both my calves, like to the point where I woke up this morning, I couldn't get out of bed.
OK, so now tell me about the leg.
I struggle standing up, walking around.
Yeah.
It's just, it feels like constant cramp.
OK, both legs or just one?
Both.
Right, and whereabouts?
Like, all my calf.
All along there?
Yeah.
And you ran for how long do you think you ran for?
A good 5-6 mile running for a good couple of hours.
And for a couple of hours?
Yeah.
Right. We'll have a look at your legs and sort that out. How are you feeling about what happened?
Paranoid. Really paranoid.
Yeah.
Go in there. Come in. Hi, honey. Please take a seat. So my name's Dr. Eunice. I'm one of the GPs working here. This is Angelia and your mum?
My name is
Amber. Yeah, hi, Amber. How can I help?
She hasn't been very well. I think she complains a lot about stomachache all the time.
Where in the tummy are you having the pain?
In the middle.
Do you have the pain at the moment? No. OK. When was the last time you had the pain?
About 3 hours ago.
OK. When you go into the toilet, when you're doing a poo, I'm going to ask you some silly questions about poo now. Is that OK? When you're going to try and do a poo, is it hard to get the poo out? Do you have to strain a lot to get the poo out? OK. If I show you pictures of poo on my phone, if that's OK, would you be able to tell me which ones you have? I know it's silly. I'll just... What sort of poo do you get when you do a poo?
That one and that one.
OK. So when it's this one tells us that you're a bit constipated, OK. Have you noticed any blood or anything when you wipe? Nothing on your tissue, nothing like that? No. OK. What's her diet like?
She eats fine.
What sort of food would she eat?
Mainly containing bread.
OK.
She likes paninis.
What about vegetables, fibre type thing? You're already saying no very much. No, OK. Because I think that's part of the reason. So normally when kids are constipated, usually diet has a big control. So we need to make sure we drink plenty of fluids, but also plenty of fibre, so vegetables and things. Can we have a feel of your tummy? Would that be OK? Perfect. So if you pop up on there, and if you lie back down for me, honey, is that OK? So all we're going to do is feel your tummy. Is that it? That's all we're going to do. No pain at the moment? No pain down there? Bit of pain there, OK. That's fine. If you pop back down there. I think we're going to give you something to help with opening your bowels. So this tummy pain might not be, but it's likely that it's all related to this constipation that you suffer from. What we give you to help with that, we give you some medicine. But actually, the main treatment for it is going to be looking at her diet, make sure you're having the good type of food. I know they don't taste nice. You know, I was horrible when I was a kid with vegetables, but like now I know the importance of it.
Thank you ever so much.
That's fine. Thank you.
Thank you.
Thank you. See you later.
Thank you.
Is that okay? Thank you. See you later.
Still got 2.5 hours left.
Who was?
Me.
2.5?
Yeah, but well, you know what I mean.
2 hours and 20 minutes. Every minute counts. So it's 10 minutes knocked off of it.
Once you're in the hour, it's a breeze.
Oh yeah, no, tell me about it. We've got a temporary registration patient coming hopefully soon.
I feel like if I press these, I'll shoot out of this chair.
Are you nervous about going out or anything like that? Have you been out since then?
No, I was going to get bus time. I couldn't even get bus time. I ended up getting a taxi and...
Yeah, it's a very stressful situation to have been in. I think anyone would feel nervous about going out after something like that. Talking about traumatic experiences is really helpful. Mental health and well-being is so important, especially in young men. It's just as important as your physical health. Evidence suggests that young men are most at risk of suicide. So if you are feeling troubled, down, anxious, please come and see your doctor. We're here to help. So your legs and the difficulty with your legs, that's easy for me to take care of. It's how we manage the kind of the impact of being chased by these people.
It's paranoia, like there was someone who knocked at my door today and I wouldn't even go open the door.
Right, right.
Just because 2 months ago I ended up getting robbed at knife point.
Oh, God. Have you had any support kind of through these incidents that have happened to you?
I've done like therapy before. I've been on like all the antidepressants and stuff like that, which in my opinion I don't think they do anything, but...
They don't work for everyone, you're right. And if you've been through an awful situation or you're going through an awful situation, they can never take that away from you. I think there's more going on under the surface. We do have a fantastic counsellor here at the surgery, and she does talk to you back as well as listen. The first few appointments are about listening and getting to know you, but then after that, it's about talking about how to cope with things and how to manage things better. So why don't we arrange to see each other in a couple of weeks after today and make sure that side of things is settling, and if not, we can think about how we manage that.
Yeah.
Let's have a look at your legs. That's what you're really here for, isn't it? OK. So...
Give me a second.
No, take your time. Right, so if you just lie down on there for us. And I'm just going to have a feel of your legs. Is that sore?
Yeah.
Yeah, they are very tight, aren't they, your legs? OK. What's happened to these muscles, really? It's just because they're not used to that distance of running, as most muscles aren't. They've become swollen and tender as a result. We need to give you something to reduce all this inflammation down. OK, I'll sort that out. Just come out when you're ready, Simon. I think there's a lot of positive things about you, Simon. I was just thinking about it. You're a young lad. You've been through a lot, you know. It's difficult things to talk about, but, you know, you've talked about them, and I think that's really important.
Yeah, it's hard to speak to my mum about stuff like that, and because she'll worry more than me. And
does she get worried as well?
Yeah.
As mums do, eh?
Yeah, and I don't want my mum getting more worried than I am.
Yeah, I think that's fair.
There's no point putting pressure on her, is there?
You're a nice lad, Simon. Oh, don't forget this. This is the key to your legs getting better.
Thank
All
you.
right, see you in a bit. Bye.
Wonderful, thank you.
I can keep hearing, like, you know, beep noises.
Not sure I can see anything. It's there, right on the there, so it's there.
Sometimes in the middle of the night, it's like drum beats. I can hear this dum 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 dum, and then it stops.
Right, I'm Dr. Caris, and we've got Karen knocking around.
Yep.
So,
sorry, what's your name?
Dr. Caris.
Carey.
Caris.
Kelly.
Caris.
Carey.
Toe your doctor mentioned. Toe your doctor mentioned.
Yeah, I'm not.
Yeah.
No, sorry. Yeah.
Sorry.
Come on through.
Thank you.
Have a seat, Mr. McGowan. So my name's Gemma. I'm a physician associate student working with Dr. James this morning.
Right.
Are you happy to speak with me first? And then we'll get Dr. James in. Is that OK?
Yeah, sounds, yeah.
Perfect. So how can we help you this morning?
Well, I've gone deaf in this year. Probably about 70% deaf.
OK.
I think I'm bunged up. You know, whatever the word is, congested.
Yeah.
That eye's not
The eye's watering as well.
Runny nose?
No, it's blocked.
Blocked nose as well?
Yeah.
Are you happy for me to do a few examinations on you today? Is that all right?
Yes, love, yeah.
So I'm just going to start by taking your temperature. So just going in your ear. Go in the good one. Perfect.
Is it?
36.3, that's absolutely normal. I'm just going to go in the good ear first, if that's all right.
Yep.
And on the other side. Tell me if it's uncomfortable or painful.
No,
at
it
any
won't be, love,
point.
no. It won't be. No, it's not.
So when I summarise to the doctor, it's the ear that's concerning you
definitely,
most,
'cause,
isn't
well,
it?
even though it's me, and you know, like if I go like that,
Yeah. That's what it feels
I
like.
can hear that inside like a right loud noise.
I'll go and knock. I might be a few minutes if he's just seeing
Yeah, it's
someone,
all right.
but he'll come back in here with me.
I can nod off, can I?
Yeah, have a sneak if you want.
Right.
Right, thank you.
Okay.
69-year-old gentleman, Mr. McGowan. He's come in with 3-week history of gradual hearing loss in his left ear.
Okay.
It's sounding quite like a viral infection. He's got a bit of a stuffy nose, been feeling a bit under the weather. Sorry for the wait.
Hi there.
Hello.
It's Dr.
All right.
James. Nice to see you.
All right.
So I understand that your hearing's been down a little bit.
This one, yeah.
Is it always in that one?
Yeah.
Sometimes if you're blocked up in your nose, there's a little tube that runs from your sinuses to your inner ear, and that little tube is blocked up.
Right.
And that pulls the eardrum a little bit down over the small bones of the ear.
Right.
And then that's probably what's caused your hearing to drop down.
Yeah, right.
And it'll probably stay drop down until this clears.
Right.
So it might be 4 or 5 weeks.
All right.
Altogether. Can you breathe in and out?
No, this nose is... I can there.
That's really blocked,
Not
isn't
that
it?
one, yeah.
Have you broken your nose before?
No. Not that I know of.
It's quite inflamed and a bit angry on that side.
Right. In the past, when I've had it similar, I put my head over that albus oil in water.
That would help, definitely, what you just described. The other thing is a nasal spray, so I'll give you a prescription for that, and that should open it up.
Right, right.
Well, I'll go and do the prescription. I'll take Gemma with me, then I'll go and sign it, and she can bring it back for you.
Okay.
Is that okay?
Yeah, thank you.
We'll see you in a second.
Yep.
That's fine. That's good. Yeah. I think hit the nail on the head there. A physician's associate is something that's been used in many different healthcare systems throughout the world to really good effect. They primarily support the clinical team, and that might involve seeing acutely ill patients on that day under the supervision of a doctor, helping triage or work out who needs to be seen most urgently, and also helping us manage some of our complex and chronically ill patients alongside the doctor. This is likely to become more normal in the future.
Right, here we go. Sorry for keeping you so long.
Okay, that's all right.
So this is the nasal spray. It probably will take about a week or so to start feeling the effects.
Okay,
and if after a few weeks you're still exactly the same, no better, do come back.
Right.
Is that all right then, sir?
Yes, love. Yes,
Thank you very much for speaking with me. Sorry we've taken so long today.
No, it's all right. Thank you.
Take care.
Bye. Bye.
Bye.
Number 17. You're both together, aren't you? Yeah. And can I just take a brief indication as to what the problems are today?
Mine is for a repeat prescription, and also I'd like to see the doctor about the pain I'm suffering, because I'm like it's a constant 24/7 pain.
And mine's for sickness.
So I can get you both seen together if you can either sit and wait until 10:20 or come back for that time.
Yeah, we'll come back at 10:20. Can you wait on her?
I will.
Yeah. We'll live across the road 5 minutes. That sounds good. Similar like a sit and wait.
Yeah, we did used to do sit and wait many years ago, but we decided to change because it was just too busy and not everybody was getting seen.
Well, where we used to live, they still do the sit and wait.
Yeah, you see, we're a very big practice, you see. We've got over 23,000 patients, so if we did that, you can imagine how busy it would get. Lovely. So that's both your appointments this morning. You'll both be seen together, OK? Yeah.
Okay.
All right, no problem, thank you.
Here we are.
Hi, come on in.
Sorry, they kept me up there.
Oh, I know, that's why We know there's a bit of a queue sometimes in the morning. So, it was this thing here, wasn't it? Would you mind if I just refresh myself? OK. Right. OK. So we've done thank you for that. We've done a biopsy.
Yep.
It's come back as a little bit thicker than we would have, than I initially thought.
Yes.
So the plan today is to remove that completely.
OK.
Just show you. From what we can see, if it's that sort of area, the current guidance is we're to measure 4 millimetres in all directions, and then we remove all of that, so a cuff of healthy skin.
Yes.
Okay?
Yes.
Right. Right, I'm going to draw on you now, OK, just so we can get the boundaries.
I have to say, it's better than going to the dentist, this.
Yeah, I agree. Right, OK, grand. Right, here we go.
Little sharp.
3, 2, 1. Skin cancers can appear in various different forms, and often in their very early stages can be hard to spot. Sometimes they can be just a small pink mark that doesn't settle or a scab that doesn't heal. In Barbara's case, she didn't have a scabbed area or a non-healing area, but it was clear to me once I'd looked at it down the dermatoscope that it was cancerous and needed to be removed. If a patient is concerned, then they must go and seek medical advice and get checked over.
You're doing really well.
So at the moment, I'm just doing the deep layer.
So how do you practice doing stitches?
On an orange. On an orange, you make a cut in an orange
And
then stitch it back together. Yeah, that's what I used to do.
So when I first saw those 3 little red, almost like pinpricks, how long would I have had this growing?
Well, it's a spectrum, really. It sort of starts off at some sun damage where the skin just doesn't heal particularly well. You get these little marks, and then you start to get little red or white marks, and then those can sometimes change into these things. Right, 5. What do you think, Karen? We're all right there, aren't we?
Well, I need the mirror now, you know, like you do at the dentist.
We haven't got a mirror, have we?
I'll see it when I take the dressing off.
Yeah, leave that. I'll just leave it like that.
Thank you for that.
No, you're most welcome. Any other questions?
No.
Right, I'll leave you in peace to get yourself sorted.
Thank you.
You're most welcome.
Come and have a seat. I'm Becky, one of the nurse practitioners.
Hiya.
Hi, I think we've met before, haven't
Yeah.
we? Yeah. Hello there. What are we doing today?
It only happened yesterday. She was a bit chesty.
Yeah.
And then last night I was watching her breathing. She was struggling, you know, like breathing really badly.
Okay. And she went in hospital, didn't she, last
Yeah.
year, did she, when she had bronchiolitis then?
Yeah.
Can.
She's got a high temperature, so I'll give her Calpol at 7:30.
Okay. Are you clapping? Are you clapping? Hey. And has she been coughing, runny nose
She's
or
had
anything?
a cold for about 2 weeks.
Okay. Right, sweetheart. Do you want to start getting her undressed and have a little look at you? Right, well, listen to your heart, aren't we? Hey? I'm gonna pop that there.
No, it's...
What's that cough been like?
Barking.
More like a bit of croupy cough, really. So we're going to give her these tablets now, and then we're going to repeat it in 12 hours.
Right.
So do what you're doing. Paracetamol, ibuprofen, lots of fluids, wet nappies and things, OK?
Yeah. Right, that's fine.
Yeah. But we'll see what she's like this afternoon, and then we might just have to see her again tomorrow as well. Just
Yeah,
to make
that's
sure.
fine. That's
Is that
totally
all
fine,
right?
yeah.
OK, I'll get door for you. All right, sweetheart.
Thank you ever so much.
See you later on.
See ya.
Bye-bye now.
Sylvia, please. Hiya, Sylvia.
Hi.
Come through. Come in, Sylvia. Please take a seat.
I'll have to take my coat off. I'm absolutely cooking.
My name's Dr. Eunice. I'm one of the GPs working
Yes.
here. How can I help?
But I cough and cough and cough. And then the sneezes come. It's uncontrollable. I can't stop it.
There's a lots of different causes for cough. One of them is an infection.
Yeah.
Can we have a look? I think
Yeah,
that'd be
of
the
course
best
you
thing.
can.
So let's check your temperature first whilst you're seated. We'll check your temperature and your oxygen level. And then what we'll do is we'll have a listen to your chest.
Please.
You've got beautiful earrings on, or studs. 36.8 temperature, that's fine. This tells us how well you're breathing. So your oxygen level at the moment, 98%, which is very good. And your pulse is 67, which is perfect as well. So what we'll do is we'll pop you on there, flip up the curtains round. We want to have a listen to your back and I want to have a listen to your front. And if you just take a deep breath in and out through your mouth for me, honey. Gonna tap on your chest. That's okay. Can I have a listen to your front as well?
You can.
Do you want to pop up behind the curtain for me?
I'm just kind of coping because I lost my husband in end of May.
This year?
Yes.
Oh.
And he'd been in hospital before, you bring them out. And this time he went in and he didn't come out. So it was
Must have been a
bit
shock.
traumatic. Yeah, it is a shock. He had internal bleeding. And obviously heart failure at the end, of course.
It's horrible losing a loved one, isn't
is,
it?
yes.
And I think nothing can sort of replace that bond.
No.
How about you in terms of friends and stuff? Are you getting out?
Well, I do some voluntary work. I've done it for up to our 12th year.
Mm-hmm.
There's a church thing that has babies and mothers and carers come. They come for an hour.
A huge community, isn't it?
Yes,
Yeah.
I worked as a nursery nurse all my life with children, small children. So I've been very fortunate.
In terms of your chest, when people are coughing and coughing for a long time, I want to make sure that we've had a recent chest X-ray just to make sure that
No, I haven't had one for a
sounds
while,
okay.
yes.
So I think let's get a chest X-ray
Yeah.
done. Listening to your chest, I can't hear signs of infection. No. And your oxygen level was 98%. You know,
good,
all of that
isn't
is very
it?
good.
Yes.
Yeah. But obviously,
Good.
if you do start bringing up the phlegm that you can see, or
Yeah.
things are getting worse, we want to see you again. But right now, touch wood,
That's lovely.
you're fine.
Oh, that's lovely.
And I hope it continues that way.
Yes.
Is that okay?
Oh, that's brilliant.
It's lovely meeting you. I'll pop this on. Do you need any help?
No, I'm fine, love. It's just I'm careful with this shoulder. It's a pleasure to meet you.
It's a pleasure to meet you.
Yes, and I'm very reassured with that.
You are a delight, Sylvia, honestly. Pleasure to see you. I'll leave an X-ray form out in reception for you.
Yes.
Out that way and down.
Thank you, dear.
She is lovely.
Take care.
Bye.
Thanks. Bye-bye.
Thank you very much for your help.
Cheers.
Take
You
care.
take care.
Bye.
Thanks. All the best.
Thank you.
All right, see you later. Bye-bye.
All right, then. Thanks
All
a
right,
lot.
take
Bye.
care now. Bye-bye.
That's all right, we'll find you on the system.
How can I help?
I've developed a rash.
Right.
Pretty much all over my body.
Right.
So this happened on Monday night, was the first time I noticed it.
Okay.
I'll let you look at it, but
Yeah, yeah.
it looks a bit like chicken pox.
Okay.
But it's not chicken pox, I'm pretty sure, because I've
Mm.
had that.
Right.
But it's very much like...
So, let's just have a look. So, it's quite flat to the skin, but it's not itching.
Yeah, it's not itching.
And did it all just come up, or did you start with one spot?
No, it all came up.
It all just came up and it's not itching you at all?
The first time I spotted it was Monday night when I was going to bed. So I've been taking antihistamines for a couple of days.
That's not helped
It's got neither
at all.
worse nor better. It's
No.
just...
And also, so if it was allergy, you'd expect, A, it would improve with antihistamines, or B, it would be very itchy, but it's not itchy. Infection-wise, you don't have a fever, you feel well, you've not had a sore throat recently, or any infection like that at all. I might see if I can pick the brains of Dr. Mackenzie next door, who's our skin guy.
Yeah.
Do you mind if I just quickly see if he's around? I won't be a second. Can I just really quickly pick your brains?
Excuse me.
Right, so there's a gentleman here with this is Dr. Mackenzie,
Hi.
with a 5-day history of a rash. It started on Monday. It's not been itchy in any way. It's not responded to any antihistamines at all. Are you not on any medications?
No.
No.
Didn't start as one batch.
I thought I asked that.
Came Monday night, took my clothes off to get ready for bed, and I was covered in it.
Right. Yeah, they're all sort of leaf-shaped.
Yeah.
One has to ask the question, no risky behaviours?
Absolutely not.
Good. There you go. Adults with a rash, you got to think of that.
Yeah. He's been well in himself. He hasn't had a fever, no preceding sore throat or anything like that.
I reckon that's pityriasis rosea.
Yeah.
That's a classic sort of sign there.
What, they're scaling?
Yeah, the sort of scaling. I reckon that's what it is. So it normally take 10 to 12 weeks before it's sort of completely gone.
Okay.
You know, no creams will really make it better. Okay.
Brilliant, thank you. Okay, do you want me to print you off a little information leaflet?
Yeah, that'd be helpful, yeah.
Yeah, the rash, there's a nice photo of it here. That's probably
That looks very similar.
quite similar, isn't it? Not contagious, so won't spread to other people.
And so just expect it to kind of disappear over the next number of weeks?
Yeah, 2 to 10 weeks, but can last as long as 5 months. But hopefully it will be sooner than that.
Don't plan to go on any beaches between them.
No, just cover it over.
I swallowed, do you know how many
put
tablets?
a note in your car?
13 a day.
Really?
And it's driving me potty.
Oh, that's a lot, isn't it? Yeah.
My cat licks me because it's salt and it makes his fur soft.
Oh, really?
He's a Persian.
I think once I go to just having to do the Wednesday one, it's fine.
It'll be all right. Come in. Hi. Charlotte, is that right? Hi, I'm Dr. Rose.
Nice to meet you.
Hi. This is Laura. She's a healthcare assistant who gives us a hand. So,
time for the coil.
Be looking forward to it.
Dreading it. Yeah, I know it hurts.
Because you've had it done before, haven't you?
Yeah.
You're keen to do the same thing again.
Yeah, although it hurts for the first, I found for 2 weeks afterwards, then for 5 years it's absolutely fine. So it seems like the best option of a lot of them.
So this is the coil that we're fitting, so this is what it sort of looks like. Basically what we do is I'll use the speculum, which is the thing that opens up your vagina so we can see your cervix, and then what I'll do is I'll remove the coil that's there at the moment. Okay. We have to go through the things that can go wrong. It's very unusual that anything does, but we just need to explain what can happen. No contraception is 100%. There's a tiny risk of pregnancy. If you were to get pregnant, then the pregnancy is more likely to be in the tubes rather than in the womb.
Someone told me their friend was born with, their friend's baby was born with a coil on their head.
Yeah, it does happen.
I've heard of something.
The worst thing that can happen to me as a doctor during a coil procedure is if somebody faints. This isn't uncommon because when we're fitting the coil, we stimulate a nerve, which makes it more likely for patients to faint. Because we can't see into the womb, there's a small risk of passing the coil through the wall of the womb. Sorry, I know this is the worst thing to tell people, isn't it? Just before we're doing it, but we sort of have to explain what the possibility. This
Have
is
you
never
done that before?
Never, never. So does that all make sense?
Yeah.
Yeah. You happy to sign your?
I am. My womb away.
Your womb away. It's okay.
Yeah, hello.
Register baby?
Yeah, we just called. He should see a doctor. He's sick.
I've got it. All right. Go up to the 3rd floor if you want.
Nice to meet you. Alice, come on through. Grab a seat. Grab a seat. Right. How can I help?
Misha is now 11 days and totally healthy from day one, gained weight from day one on.
Great.
So, but this afternoon he started coughing and getting a bit weaker than he was usually.
Okay. How old is he? He's 11 days old?
Yeah.
Okay. And is he breastfeeding or bottle feeding? And that's gone well?
Yes.
Feeding okay?
Yes. He never lost any weight even in the beginning.
And nappies, how are they?
He shits maybe 10 times a day, but he's gaining weight and he's healthy.
But the cough is what concerns you?
Yeah, and usually he's just totally boisterous and strong. And
quiet.
he's like...
Should we have a look? Is that okay? Can you unpop him?
Yes.
And just roll this up. Now, can I come this side and you stay at the head ends? That'd be perfect. Okay.
We thought he has a slight temperature, nothing big, but...
Okay. Let me have a listen before he starts crying. This is not... Okay, buddy, let's have a listen. Oh. I know, I'm sorry. It's all cold and horrid, isn't he?
This mucus is like something related to a cold? Or?
Bear with me 1 second, let me just have a good listen.
You all right?
Yeah. Come on, ladies, I can do this.
You'll be fine.
Come on, Mr. Coyle.
You all right?
Yeah, sorry.
It's all right, no. It would be funny if you weren't.
Yeah, I know.
So this is the speculum going in, okay?
It's like a smear test, this bit, isn't it?
Yes, yeah. So it just feels a bit cold.
Yeah.
You're doing really well.
Okay.
Hey,
Sorry, do you mind if I hold?
No, of course you can.
Are you all right?
Yeah.
You'll be fine.
You okay?
Yeah.
So we're going to take the coil out, okay?
Is it a nice big cough for me?
Cough.
Okay.
We go.
Is it out?
Yeah,
Yep.
that's out. You all right?
Hurts quite a lot, sorry.
Okay. Is it easing off? It's not what it was like when you got that sharp?
It's still quite sharp, but it's not as bad. It's kind of coming in a wave now.
Yeah.
It's still there. Is that normal?
Yeah. So this is the coil going in now, okay?
You all right?
Is it in?
Yeah.
You've done really well.
I know I haven't.
You have. You've done amazingly.
I was practically crying. I think that's amazing.
I think it was the thought of it.
Hooray, 5 years.
Yeah.
You don't have to worry about it. Just
Thank
sit
you for
there
holding
for a
my hand.
moment. That's all right. That's what I'm here for.
Do you feel all right?
Yeah.
The whole going into the knife sort of thing.
Yeah.
I couldn't
Like
do it.
people who want cosmetic surgery, like who are willing to put themselves like...
Yeah, just needle me, just chop me open, I don't care. There's no point. It's like my boobs are good as they are.
It's exciting.
So he's a bit congested as well, isn't he?
Yeah.
When he's just breathing like this.
That has been for now 1.5 days.
Has it? Okay.
2 days, something.
Okay, young man. Let's get you up. Are you okay to give him cuddle him over your shoulder?
Yeah, of course.
And I'll just have a listen to his back as well while he's nice and settled. Just nice and settled. Just have a listen.
Haven't lost all your strength.
Is Mum at home?
Yeah.
Okay. Just pop him down for a second again. Oh, no. Oh, okay. Why don't you pop his things back on and then we'll have a chat. He certainly sounds congested when you do listen to him. But actually, when you listen to his lungs, his lungs sound clear.
Good.
So there's no sign at the moment of any infection on his lungs. And his heart rate is not much higher than it should be for his age. So I think sometimes when you have a lot of mucus at this age, because everything isn't as developed, it's difficult to clear it. I think some of the things that might help with that is that, so generally steamy environments, I think would be useful. Some moisture in the air.
We have a thing like that. We put it
around the bedroom. Perfect. That will be useful. And you can get. I mean, they're very little at the moment for. Saline sprays, but you can get sprays for the nose that helps from the pharmacy that help clear some of when it's very sticky.
They have that down here?
Yeah, downstairs we'll have that. So let's try the humidity. Let's see how this settles in the next few days. You need to keep a close eye because of his age. They can suddenly change, as you know. So if you find that actually you're struggling with feeding, the nappies are not as wet as they were.
Yeah.
Or he's still not as alert, or things are not improving. Or if you look at his chest and you see that his ribs, he's pulling in his ribs, or at the base of the throat, he's pulling it in when he's breathing, that's a sign that he's working too hard with his breathing. And that's a sign that you should get somebody to see him, even if it's in the middle of the night.
Thank you very much.
Not at all. You're right to get him seen, yeah.
Thank you so much.
No problem, he's nice and alert now. OK. All right,
bye-bye.
Take care now. Bye-bye.
He's had a viral infection. He was never that ill, but it tickled up his airways.
Hello. Who's this? Oh, hello.
Are you ready? Oh, good girl.
So you noticed those spots first yesterday as it came on today?
Yeah, and they seem brighter.
Sometimes with skin rashes, it could be due to an allergy. Has anything changed at home? Any pets? No? Or any... Can't smell it yet. Can't smell it yet.
Meningitis is basically bleeding under the skin. So when you wipe a finger over it or put a glass on it, it doesn't disappear. Don't worry about any of that, okay?
Hi, how you doing? You alright?
I'm seeing number 8. I'm
Sorry.
I feel terrible. I've gone deaf in one ear for start.
Okay.
Which I don't know why. I'm getting a noise there all the time, and I can't hear a damn thing. It's driving me bonkers.
One thing that I was quite keen to do, remember last time you had that cyst?
Oh yeah, got
Just wanted to have a wee look at that if that's
Well,
all
the antibiotics seem to have worked, and it's got like a crust on now.
Yeah, I think we'll have to see what becomes of that, really. That infection has settled down and that there's no real mole there anymore or anything.
If it was a mole, I must have caught it or something like that.
Well, should we just see how it goes? We'll keep an eye.
I'll keep it. Well, I mean,
keep an eye. We're going to be meeting anyway, aren't we? So we can just periodically review it. Okay.
Yeah, sure.
What else would you like to talk about today? Obviously, there's a lot going on, but
I would like to get a consultation with a drink specialist to get me off the booze because I am seriously concerned.
Yeah.
Because I'm getting home now. I'm depressed.
Yeah.
I'm not suicidal. Don't get me wrong, but I just start drinking, and I can't actually just say I'll have 2 and stop.
Yeah.
Once I've had 2, that's it. Boom. I don't know what the answer is. I really don't. I know it's not doing me heart any good at all.
Yeah. It generally doesn't do you good to drink lots and lots.
Especially, I mean, I do appreciate it, but I've got no willpower. I try and try and try. It's very, very hard,
Yeah.
But I do want to stop drinking. I just detest it enormously.
Yeah. Dropped a line to that alcohol liaison.
You haven't heard from them yet?
I was hoping you might have heard from them.
Not a sausage, nothing. I'm being honest, I cannot stop. It's as simple as that.
Yeah. Okay. Alcohol services, I'm going to write to them.
Okay.
Do you want me to give you their number as well so that you can...
You could do, if you wouldn't mind. Yeah.
So I'll find that for you in a sec. Okay.
Okay.
Do you want to catch up with me, in a couple of weeks?
Should I make an appointment or should I just give you a ring?
Talk on the phone if you want next time, save you a trip down.
Okay.
Yeah, and then we can see if there's anything that you feel you need to go see and I can stick you in for an appointment.
Fine.
All right.
Thanks very much.
No worries. Take care, all right.
I'll see what I can do about the
Yeah, all right. Look after yourself. All right. Cheers. I referred him to Drug and Alcohol Services quite some time ago now, and he was transferred to your team because he fell out of area, full stop. He's really desperate to cut down his drinking, and I would appreciate any support you could provide as soon as possible, full stop. Thank you for taking the time to see him. full stop.
Three people queuing and just me, Carol and you picking up. Good afternoon.
It's okay, it's one each.
Putney Mead, how can I help?
Putney Mead, good morning, Nicola speaking.
Susan Watts, please. Thank you. Come through. So, welcome. I haven't met you before and think you were booked in to have a health check. Is that right?
Yes. Can I just give you the history? Then, it sort of makes sense of it.
Yeah.
I use my stress by using adrenaline. So I'm on overdrive the whole time. And my father shook, and when I do that, I don't shake.
Yeah.
But to eat a bowl of soup, it's impossible. And last weekend, could I stop my shakes? They're the worst they'd ever be. So I think it's a hereditary pattern.
Yes, it can
rather
be.
than it being dementia
Yeah.
or anything. And I think I'm just so stressed I can't walk in a straight line. Signing my name now, you would have thought it was a spider on the website.
Okay.
So I, probably because I don't want to go down the Parkinson's line, dementia line, I now put in a program of exercising myself and walking much better. And I can't say in 3 weeks it's made much difference. Makes sense?
It does make sense. It does make sense. But it's an unusual presentation, and
Really?
yeah. What are your concerns that you think these symptoms might be?
I am concerned in case it's, I'm pretending it's not Parkinson's, but then I read the paper today saying everybody's encouraged to go to their doctors and doctors get £50 right now. Oh, God, I've got, it's in the Times.
£55.
So I'm very conscious. I put myself in a category that really I might not need to be there. I just need to relax.
Well, I think you've done the right thing, so you're not just living with it. Susan's a psychologist herself and is very aware of anxiety and stress, and she very much, I felt, wanted me to diagnose that was the cause of the tremor. I just felt I couldn't minimise the symptoms as she wished me to. Okay, so let's do some coordination test. It's one of the ones that we ask patients to do is just put your hands straight out in front of you. So
I'm very good at that.
Yeah. And now open your fingers. Yeah, close a bit.
I mentioned that
How do I get back to mine?
the car was stuck in. In M&S, and he said, there was one yesterday as well.
And then you do that with sync.
He's in 9, he's in a different room now.
Oh, is he? No, we were in 9 yesterday.
We weren't in 12, wasn't yesterday.
Nice to see you. Come on in.
Likewise. Do you live anywhere near Kingston?
Do I live anywhere near Kingston? No. Why is that?
Oh, in 2 days, 2 people have jumped off the roof of M&S. In 2 different parts of the store, and our car is trapped there now until tomorrow.
Because you couldn't leave because someone.
Because they jumped off the car park.
Is that right?
Yes.
Gosh, that's very sad, isn't it? How are you doing?
I'm fine. The blood part of the urine disappeared after 1 tablet.
Did it?
Yes.
Okay.
I still took all 6.
Great. So no more bleeding in the urine?
No.
Any more clots?
No.
Nothing like that?
No.
You were going to see the urologist,
Yes.
is that right? Have you seen the urologist?
Yes, so did you want to see us today to report
how things
to you
gone?
how it all went? Certainly. They reckon they'll get something to you within 48 hours.
Okay.
But hot off the press, you can have it from us.
What did they say today?
I've got stage 1.
Okay.
Bladder cancer of an aggressive type. When they biopsied all the crap they'd taken out, they found that the cells were would have been of an aggressive nature.
Right.
No evidence of it in the muscle wall.
Great.
And that's it, really. I'm very lucky, primarily because of you insisting on these constant samples and then taking it that bit further.
When you do pick up a cancer, it's very rewarding because it can have a big impact. It has a huge impact on people's lives, and most bladder cancers, thankfully, are picked up very early, before they've had a chance to spread into the lining of the bladder. And therefore, the prognosis for most bladder cancers, thankfully, is very good.
And how are you feeling about all of this? I mean, it's all kind of new stuff, isn't it?
Wonderful. It's whatever it takes.
Whatever it takes, yeah.
whatever, and I don't feel at all bad. I feel absolutely wonderful that I've got it, because I know I've got it.
Well, in fact, you know you can do something about it, and nothing else is involved. And I think that's the important
She
bit.
did mention the surgeon, who's a lovely lady, but bladder cancer rarely extends beyond the bladder.
This gentleman is an incredibly positive and determined gentleman. But in a consultation, I think I'm doing two things in my mind. One being present in the room and listening to what's being said, but also being curious about what I'm not hearing from someone who's dealing with cancer, and why I might not be hearing that. And that's as important for me. OK, good. So you're feeling positive about it?
Mm-hmm. Yes. I don't think I've ever felt particularly negative.
No. Great.
You've not noticed, have you?
No.
Have you?
Well, a couple of times you've been a bit wobbly.
Well, when I made a reservation at Dignitas, I suppose you could call that slightly negative. But they said they didn't have any vacancies that Tuesday.
Will you do it when you stand in front of me? Put your fingers out, extend your arms and open your fingers a bit. And now could you close your eyes? Okay, I'm going to push the hands down and I want you to bring them back to the place that they're at. Now this time I want you to move between your nose and the tip of my finger as quick as you can. Good.
Oh.
Good. I want you to try and do that as quickly as you can. Quick, 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 quick. And the other side. That one's harder.
Much harder.
Yeah. Now try to do the walking and the balance, okay? So one of the simple ones is just toe heel, okay? Well done, good effort. Okay, so if you could just write that underneath, that would be great. Thank you.
Far slower than I used to write.
Really? Yeah. Yeah, and this arm was tremoring as well.
Oh, was it?
It was when your hand. Yeah.
Can you tell more than that than the other things you've been looking at?
I think that did give me an indication of probably how difficult it is, being such a capable lady, to then have to work so hard at doing something like that. I was also slightly concerned about your toe walking.
Yeah.
That would make you quite at risk of falling as well as you get older. And it's fantastic that you're doing exercise, and we should really continue because that's going to help your balance. But
right.
You would be more vulnerable for falling as you got older.
I'm very conscious of walking now. I'm trying to keep a straight line.
Yeah. I think I should refer you to see a neurologist.
Right.
I can't diagnose anything just straight off.
Okay, neurologist here I come.
Neurologist, here you go. I'm so glad you've come.
Lovely.
Thank you.
I know, thank you.
You've been so candid.
I don't know how
and
you
open.
manage it, to give this amount of energy out to each patient. Just don't know how you do it.
Well,
I hope tomorrow's a rest day.
It makes it a more enjoyable job.
For some reason, I'm covered in a burning rash.
Right, well, you're a little bit of a mystery.
I have a hot shower and it goes away.
It's weird, isn't it?
You lost 2.5 kilos in 4 days.
Yeah, that's a mystery.
I keep getting these blood blisters. I mean, these are puzzling, I must say.
Sometimes in medicine we can't say what specifically something is, but I can tell you what it isn't.
What can I do for you?
I have a mobility issue in my right hand.
Okay.
I'm an office worker. Typing's becoming incredibly difficult, really quite painful. It's kind of something which has evolved over the last 6 months. Keeping it really simple, left hand.
Yeah.
That's it fine. Right hand is just have very limited mobility in it.
Okay. And what's the origin of that?
I don't know.
Okay.
I'm typically male, typically late about coming to doctors, all of those things.
Are you left or right-handed?
Left-handed for writing, but like right-handed for sport.
Okay.
The thing I'm wondering is I've learned golf this year. Don't know.
You have enough dexterity to do that, so to grip the club, but
I just noticed pain
typing.
Occasionally.
Do buttons up and stuff?
Doing my cuff is a lot harder.
Yeah.
But I can do it.
Have you noticed it with anything else? Tying your shoelaces?
No, shoelaces is fine.
Would you mind just tying your shoelaces for me? Or untying
It
them?
won't be a problem at all.
I'm just looking at you using that right hand, because that command, from your brain seemed to be automatic and seemed to work fine, doesn't it? Do this again, so like you're playing a piano. Do you play the piano by any chance?
I used to a little bit when I was younger, but the left hand's 100%.
Yeah.
I could do that all day long.
And you can't do that at all with that hand?
I'm commanding my hand. It's very tiring. I'm going, come on hand. It's mentally exhausting even just to do that.
Yeah.
I'm really saying, come on.
Yeah. So, for example, do this. So the elbow, shoulder, you can swing around.
I mean, I've got 2 kids. I can load up.
So
wide.
it's just the fingers, literally.
It feels
what
the
about,
fingers and the wrist.
So do your wrists for me. And round and round. Round with that one.
I'm trying.
So wrist and hand. If I touch your hands, does that feel the same?
Doesn't feel any. Without being extreme, doesn't feel like I've had a stroke or paralysis, anything like that at all.
And so the sensation to you feels the same. You're not noted, no pins and needles, nothing like that.
No, never at all. I would have come. Absolutely would have.
And just you can't.
I can command it, but I just can't translate it.
I think it's quite common in general practice for a patient to come and to have something that it's very hard to put a name on and to diagnose as something. I think whilst medicine is partly scientific, there's also a lot of art to it as well, if you like, and it's some of what we do is almost trial and error.
What I am going to do is ask for advice. We've got a kind of email advice line. What we need to do is get some sort of imaging or study on that. We can do a nerve conduction, and I just want to check if that's the right thing to do or if it's some other sort of test. So what I'll do is I'll get some advice and then I'll let you know. So I basically I don't want to send you down the wrong route.
Yeah, no, it's a tough one.
But you've absolutely done right in coming to see us, and we need to look into it and find out what's going on.
Patients seem to appreciate it if you admit to your, lack of supreme knowledge almost and say, I actually don't know what's going on here. We're human at the end of the day and we don't know everything, and as long as we're honest about that and admit that, I think they, on the whole, don't seem to have a problem with it, and I don't either, really, I don't think.
I shall get back to you in either tomorrow or Monday.
Cool.
Is that all right?
That's lovely. Really appreciate your time.
Okay.
Thank you very much.
No,
Take
good
care.
to see you. All right. Bye.
So I can do that.
Yeah, I was about to say. It's a good, strong handshake, so. All right. Bye.
I've got 40 tasks.
40. I've got none.
All right, rub it in, why don't you?
40 tasks.
I haven't. I've got none from today.
I've got one. You heard one. It's because I don't delete them. That's how bad I am.
Actually,
hello,
the
how can I
patient
help?
should come in for.
Come in.
Good afternoon.
Hello, hi. Is that Alexander? Is that right?
Yeah. Basically, about a week ago or so, completely out of the blue, in the middle of the night, I woke up to a really bad chest pain, right down the centre bone.
Right.
Nothing else really associated with it. No difficulty breathing. Nothing that was going to cause me concern or think I should rush into hospital. So I put some deep heat on it, and then since then the pain's just been fluctuating. I get a heartburny kind of sensation as well quite a lot of the time.
Is that before the pain came on?
During the pain, actually, to be honest.
Okay.
And so it comes in waves, and today and yesterday it's kind of become a little bit more consistent or continuous, I should say.
Right.
Because it's making me feel a little bit groggy as well, to be honest. And
And what had you been doing that day or the day before?
Well,
can you remember?
I've been going to the gym, and I have been going to the gym probably with more intensity or regularity than I would normally in the last couple of months. I've certainly stepped it up a bit.
Have you been feeling short of breath at any point at all?
It's not so much a shortness of breath as it feels like quite a laboured breathing.
Would it be okay if I had a look?
Yeah,
That's
absolutely,
okay.
of course it is, yeah.
And what do you do work-wise, if you don't mind me asking?
I'm an airline pilot.
An airline pilot?
Yes.
Oh, okay. And have you been on any long-haul flights or anything like that?
Yeah, I mean, I've been flying fair distances, but nothing outrageously far.
So in the last week, or?
Oh yeah, I've been flying.
Oh, okay.
I've been flying most of the week, in fairness.
Is it affecting work?
It's not affecting my work. It's just one of those things that it just It fluctuates, but it never affects my levels of concentration and anything.
Fair enough. It's just the kind of niggly thing that's there and comes on and lingers a bit. So if I push on it, can you just tell me if it hurts you at all?
Yeah, that's tender.
That's tender. That caught you. Sorry, I don't mean to make you jump off the bed. What about on the other side?
Chest itself, no,
Yeah,
it's not
chest
too
wall
bad.
itself.
It's not too bad there.
I'll let you put your
Yeah,
shirt on. Do you mind just putting your T-shirt on, not the jumper? Just going to do your blood pressure, and then I'll go through what I think is going on. Hopefully it'll make a bit more sense.
Yeah, it's fine. I'll try and relax the arm.
Yeah, absolutely. Relax as much as you can. Okay. The upper value's ever so slightly on the higher side.
Okay.
It might be because I've been pushing on your chest and caused you a bit of pain.
Yeah, maybe.
just
I don't
now.
know.
Doesn't strike me as a heart problem in any way, because heart problems tends to feel a bit different, more of a kind of tightness, pressure sensation that's worse when you're doing things. And I think you've got an inflammation of the bone here.
Okay.
But the fact that when you push on it, it's quite tender. It suggests that something quite local around that area.
Okay.
I think this is almost certainly because of the gym work. The treatment for it is anti-inflammatory medications. So I don't know if you're
ibuprofens, maybe?
Yeah, exactly. Ibuprofen, okay.
No, thank you for your help.
And I think flying's okay.
Good. If you think it's okay.
No, I think it's okay.
Funnily
In
enough,
case it was
I've
only
got
that.
days off now, actually,
Fair
so I'm not in for a while. So I'll give it a rest now for a few days, and fingers crossed it'll work.
Hi there.
Is Dr. King on the third floor?
Yes, he is. He's on the third floor.
I was just about to get there. Is your name Brian?
Yeah.
Yeah, I'll sign you in.
Hi.
Morning.
Is it Margaret?
Margaret Yakutiel.
Yakutiel, yeah. I'm Dr. Bavadia. Nice to meet you. Oh, is that just your...
Listen, I think I've got scabies. I get these frightful attacks of scratching. I mean, it began here and I managed to stop.
Yeah.
I get them on my hands. This was last week, there's the signs.
Right.
I'm also a doctor, epidemiologist. And it just looks to me like scabies. And I bought some stuff, actually. And then somebody told me there's a better stuff called ivermectin, which you can take as a pill. Can I show you a place on my...
Yeah, please do, please do.
Okay. I just want to show you where... Sorry.
Yeah, of course.
This was one about 3 or 4 days ago.
Yeah,
I scratched. I just couldn't think of anything else it could be. I've had it here.
Right.
There's not much old.
Is there anything else to see?
No.
No, okay. You've had an itchy rash that comes and goes.
Yes.
I've got no information on you. Are you normally fit and well?
Well, I've got cancer of the lung.
Right.
That's been done by stereotopic body radiation, SBRT, about half a year ago. And I had a myocardial infarction 7 years ago.
Okay.
My blood pressure's low, not high. Otherwise, I'm well.
Do you take any regular medication?
I've got some arthritis in my hip, so I take diacerin or something.
Doctors sometimes can be incredibly resilient and feel that because they have some, a lot of medical knowledge and experience, that they just deal with their symptoms. They might try and soldier on. Where are you normally registered?
Israel.
Okay.
I'm here visiting my sister.
Okay, and you're an epidemiologist? What, like a doctor, like a public health?
Yes.
Okay, all right. And how are things in Israel, all right?
Ghastly. I may have picked it up in Israel. God knows, after this war, all the soldiers coming back. But I don't know. I mean, I didn't have anything there.
A difficult one. It doesn't look like classical scabies, but as you know, scabies is the thing that mimics many forms. I haven't heard of the tablet that you mentioned.
Well, I'll tell you how to spell it.
Ivermectin is not recommended.
Really?
Yeah.
Has it got contraindications?
It's on a named person basis only available and has been used in combination with topical treatments. So I think perhaps you're better just using the permethrin.
Which is the antihistamine one?
Cetirizine.
Cetirizine.
All right.
The tablets.
Yeah.
That's for the whole body. You don't have an ointment instead. I mean, I don't need to take something when I've just got an itch on my hand.
It'd be better with that, probably.
Yeah?
Yeah. I have in the past treated doctors who have felt that we should be doing one thing for them, and I felt that we should be going down another line.
I like taking things more. I mean, I have to, but
Yeah, try it. It's tolerated pretty well by people.
Okay.
All right, take care. Bye now.
Why do doctors go to the doctor?
That's true. If you're a doctor and your friends are doctors, they could just prescribe anything for you.
Give you drugs.
Yeah.
Sorry, it's not ideal for you, is it? What can we do for you?
I'm going to see my family in South Africa next week.
Okay.
Which is quite traumatic as it is.
Yeah.
But I'm going to run out of pregabalin whilst I'm there, and I just wondered whether I could get some more pregabalin.
Is pain a significant problem then? Have we been sort of playing with things to try and get it manageable, or is it manageable at the moment?
It's not manageable because it's there all the time. So I guess we're having a sort of intensive period of trying to get this tilt assessed more.
Yeah.
And then also try to take me off some of my morphine because I'm quite heavily addicted to it.
Yeah. Okay. Perhaps not the time to start changing things now anyway, but I wonder whether, have you flown before taking these medications with you?
Yeah.
Sometimes people like a letter for those sorts of medications, which I'd be happy to, but you've never run into problems.
Yeah, I've got a prescription.
Yeah.
Thank you very much.
Anything else we can do for you?
Thank you.
Okay. I'm free. Cheerio.
How are you doing?
Yeah, the tablets are a lot better now. Thank God.
Great. Are they?
Really, really well, yeah.
Mummy, come here.
And I'm actually waking up in the mornings feeling like I've had a sleep.
Great.
I'm so happy with it. I'm so happy, yeah, I feel a lot better.
When are you going?
I'm going to Ireland in 3 weeks, and then we're going the week after. So, yeah.
And where are you going to be staying?
My sister's.
No, in New York.
Oh, New York. Oh, sorry. We're actually staying in a hotel just off Central Park.
It's a beautiful time as well.
It's lovely. I love it. Yeah. I love it. Yeah. And it's not. I don't like going away.
Do you feel frightened to go
I'm a little bit nervous because I am worrying, is something going to happen to tumour up in the air, you know?
There is a risk flying. It's different for every patient and at every stage of the illness, and actually for where in the brain the tumour is. It's to do with the pressure of the oxygen in the cabin.
The thing about it is I could be here, I could be walking down the road and something had happened, so it's one of them things, you know what I mean?
Before you go, I think I'd quite like to give you a letter as well to take with you, give a medical history just in case.
Please God, but if anything happens.
Yeah, I think what was going through my mind through the consultation was I can't make Fidelma better. But I think it was just so important a trip for her to make. It was very symbolic. She'd been given this as a 50th birthday present at the beginning of the year when she was totally ignorant that there was a brain tumour growing. Oh, I'm so pleased you're going.
Yeah, no,
I'm
really
so pleased.
No, they've all been given out to me. My mum, she's
Of course they would.
Go.
Of course they would.
Do you want to give Dr. Ham a high five?
Wow, that's stinging.
Come here, you've been
have a good time.
You've been so good to me, so you have. Really, really good.
Have a good time.
Yeah, I will. And
have a good time.
I'll see you. And
Yep.
if there's anything you want, let me know.
Yep.
I did tell you that.
You did tell me that. You did tell me that. Right, lovely to see you. Thank you. All right, bye. Bye. Oh, she's a nice lady.
Emily.
Morning.
Come in.
Hello.
Hi. Are you ready for us?
I am, yes. I've just dazed off and gone on to something else.
It's quite all right.
Come in. Hello.
This is Betty.
Hi.
And I'm Jane. I'm looking at a daughter-in-law.
Oh, right, okay. So they seem to say you had a few bits and pieces that they wanted us to
it
check.
started with that about 5 years ago.
Oh.
Then that. And I've had put Germaline on every day, but it hasn't moved it.
Right.
And then I've got all sorts.
You have, haven't you?
Yeah. And I've got one behind there and that itches. Can you see it?
Yes.
And then I've a few. One on my shoulder there.
And then on your face.
These are mostly, I won't get rid of these. I'm not bothered about
You nearly forgot about them,
that
didn't you?
And these. I mean, these are driving me mad. There's one behind me here. And that cheek there. And the touch on my forehead there.
Oh, goodness me.
But I want rid of all these on my face. I mean, my beautiful face, you see.
So can I have a look at them? Sorry, this is a bit of gel.
Oh, of course you can.
Yeah, and a bit
I
of a
just want rid of them on my face.
I've been feeling
Poorly.
Yeah.
Yeah. Any high temperatures? Have you felt hot?
Yeah, she had a temperature this morning.
Did it wake you up in the night?
Yeah, as well.
What kept you awake?
With my throat.
Was it really sore? Okay. Shall we have a look at it? Come on then. Were you going back to school today? Is this a big drama to get out of school, do you think? It is a drama to get out of school.
Better not be Halima.
No, in here. Let's have a look. Oh, your temperature's high. 38.3. Right, give me a big R. R. Oh, it does look sore in there. You can sit down. So you have got a bit of an infection in your throat there. We'll give you some antibiotics and you can go back to school tomorrow.
Okay.
How's that?
Good.
Good for Dad.
Good.
It's funny how you've been well all through your school holidays and then day you go back to school you get poorly. I believe you. That thermometer doesn't lie. Drink lots and lots of water because your lips look a little bit dry. We don't want you turning into a raisin, do we? What if you wake up tomorrow morning you're a raisin? Can't go to school then, can you?
Can't we?
Put you in some scones. That's a good idea. All right, darling. I'll see you next time. All right.
Take care. See you later.
No worries.
Sorry, what made you sort of come now? Have you suddenly got a load more?
I've been telling the doctor about this for years.
Yeah.
And they said you'd better go see a dermatologist.
Yeah. What about these on your face? How have they sort of progressed over the past 6 to 12 months?
Sometimes bits drop off.
Yes. That's not anything to worry about. But still, we want to try and treat them, and I'm just trying to think how's the best way to do it. So you've got a lot of different bits and pieces.
Yep.
I think that they are mostly sunlight damage. I was wanting to get the advice of our consultant, and she's here next week. I know it's a bit inconvenient to come back, but I'd just like another brain to help me suggest what to do, whether there's some that she thinks she's a bit more worried about and perhaps we should take a little sample, and whether there's others that she'd just be happy to put some creams on that will irritate. So they'll go quite nasty and crusty, and then it starts to come back beautiful again, but without surgery.
It'd be nice if it were ointment from my face.
I know.
Yeah.
Well, it wouldn't be nice while it was working because it'd get really crusty and it'll look a right mess. No, but it doesn't matter because after a couple of months it'll look beautiful again.
Oh,
so
yes.
that's what you want, isn't it? It's a full facelift. Okie doke.
Thank you very much.
You're welcome.
Lovely.
Okay.
Thanks for your help.
Thanks. Take care then. So I'll see you next week.
Yes.
Turn right. Turn right.
Bye.
This way.
Oh, I'm going the wrong way.
I've got a really, really, really big spider. Oh, wow, it is a big one. Look at it.
Oh my God. That's a monster shell.
It is. Now I need something to shimmy underneath. Come on, mate. Ooh, look how big he is. Whoa, oh my God. Absolutely huge. I'm gonna just go. Let's go for it. There you go. Ugh.
Hello, good morning.
Hello, Mohammed.
How are you?
What can we do for you today?
Well, basically, I need some balm cream for my leg.
And what's the cause of that?
I fell and scraped my leg on a door.
Right.
And it flared up and everything, you know.
I
That's 2011.
So quite a long time ago.
Yeah. It's still there, the marking, because
Yeah.
when I'm walking, especially when I'm doing a bit of exercise, the blood's flowing,
Yeah.
then it gets really itchy. I mean, as you can see, the skin gets really dry.
Yeah.
And it starts flaking off.
And has that colour and appearance changed over the last few weeks, few days?
No.
No, fine. Have we tried any steroid cream on that?
No, I don't believe we have.
Why don't we try that?
What will that do? Will that help the itches?
Steroid creams reduce inflammation. So when things are irritated,
Right, okay.
then it kind of calms them down. So I'm hoping that that's going to improve the itching.
The other thing, right, any chance of getting a full MOT done on myself?
So you're 51. Have you had, anyone over 40 is entitled to a one-off NHS health check MOT.
No.
Have you had it?
No.
So you can book in for that?
Do I need to book in?
Yeah. But just use the words health check, NHS health check.
Right.
And then what they do is they check your blood pressure, cholesterol, height, weight, give you a kind of once-over.
Right, that's fine then.
Unless there was a particular concern that you had, to be honest
with you,
general MOT, but
to be honest with you, I do get some pains in my chest now and again.
Really?
Yeah.
Oh, you should tell me about that. Don't just have an MOT. No, you should share that with me, please. Tell me.
Yeah.
Hello, come in. Mr. Hussein.
It is.
Come and have a seat.
Thank you.
I have a student with me as well today, if that's
problem.
okay.
That's no problem. I seem to be getting a lot of pain. It's been like just over about a week and a half. It's like all back of here, all my arm, and it seems to be, like within the muscles. I mean, as soon as I press, I can feel the pain.
Okay, and anything trigger it that you can think of? You've not moved house or lifted heavy stuff or...
If I did do, I mean, I'm more right-handed. I would have done something with my right hand, not my left.
Okay, let's have a look then, shall we? So, if you just stay sitting for a minute. Is it tender up here?
Yeah.
Whereabouts? Is it?
Well, it's more
at the back?
Yeah.
I could do to have a look at this shoulder. Do you think you could take that arm out your T-shirt? I'm conscious of you.
And can you tell you the truth? When I'm sat down not doing anything, you can feel the throbbing more, you see. That's, really tender,
So can you lift your arms up in front of you?
Yeah, I mean, I can lift them up. I can feel the pain hurting more when I try to lift it up more high.
Can you lift right up to the top? And that's hurting here in this muscle?
It's hurting all the way along here.
Okay. Can you lift your arms out to the side?
Yeah, I mean, I've tried all this at home, just to kind of try to ease them off.
So from looking at you, you can put your arm back in your T-shirt now. From assessing you there, I don't think this is the shoulder joint. I think you're right. I think it is a muscular pain. Perhaps you need to have a think about what could possibly have caused it. But the main thing I would say is give it some time. Give it a couple of weeks. And if it's still there in sort of 4 to 6 weeks' time, come back and see us. But I would expect it will go.
But what would cause it going all the way right down?
So you've pulled muscles. You've pulled the muscle here in the chest, and you've also pulled some muscles in your arm. How? I'm not entirely sure, but
this is what I can't
seems to
understand.
me like you've strained some muscles, maybe by lifting a bag or... I don't know. It can be quite a fine balancing act, getting it right between not being dismissive and listening and understanding patients' concerns. In primary care, us general practitioners are gatekeepers, and it's okay to watch and wait sometimes and not jump to investigations straight away.
It just kind of hurts a lot,
But I wouldn't worry. I'm confident it'll settle. Okay.
Yeah.
All right then.
Okay, madam.
Okay.
Thank
Thanks
you.
very much.
Okay, madam. Okay, thank you.
Take care.
Okay, madam. Thank you.
Bye-bye.
What about these chest pain?
It's just sometimes it's difficult to breathe, on the left side. When I'm breathing, it's painful.
It just catches you?
Yeah, it just
when
catches
you're
me
breathing.
now and again, yeah.
What about if you're really pushing yourself physically, rushing around?
I haven't really had much of that, to be honest with you. I don't get pain. It's like, you know, you get a stitch.
Oh, okay.
Yeah, it's that type of thing, you know what I mean?
Okay.
And when I'm breathing, you know what I mean?
Right.
It's quite painful to breathe.
And how long has that been the case for?
About a couple of months now, really.
Do you smoke?
I do smoke, yes.
Okay, all right. So do you have a kind of chronic phlegm, cough, or?
Just normal white phlegm.
Right, okay. Yeah, it doesn't sound like angina or heart pain.
Right.
It could be a bit of lung pain, or it could be a little bit of muscular pain.
Right.
I don't think the MOT is going to help that. But book in anyway.
Yeah.
Because they check you for diabetes, they check your cholesterol, check your blood pressure.
Yeah, I mean, my mother's diabetic and so is my father.
Yeah, and you're a man and you're 50-ish.
Yeah.
And you're Asian. All of these things put you at higher risk of having heart disease. I mean, obviously the fags won't help.
No, they don't actually. You know, I mean, I'm trying to reduce them as much as possible, and hopefully, you know, come off them. But it makes it very difficult.
Okay, excellent.
Right, thank you very much, Dr. Youssef.
My pleasure.
Thank you.
Bye.
See you.
What? Oh. Mrs. Kirby, please. Have we a Mrs. Kirby? Oh, bloody hell. Mrs. Ingham, although you're not on my paper list for today, my computer has all of a sudden woken up rather groggily, and your name is on my computer list. Anyway, come and let's both fight with the computer, shall we?
Computers are great when they work.
Here we are. Come on in.
Hi, Tatiana. I'm Dr. Carr. Nice to see you. Come and sit down. So I believe I'm seeing you for something on your knee. Yeah, okay. How long have you had that for?
I have a couple years already, but before I even came here, but it was very little, and it's now growing more.
Yeah.
And that's why I'm all the time with babies. I'm staying on the knees,
okay.
and it's make pain for me.
Yeah, of course. Do you mind if I have a closer look?
Yeah.
The only bit you'll feel is a little needle going into the bottom of it and putting some medicine underneath it to numb it. After that, you shouldn't feel anything at all. We then make an incision over the top of it, and it should just come out, and you'll have 2 stitches which will dissolve themselves over the course of a week. And you might be left with a little scar where it's been, and otherwise...
Maybe better.
Maybe a lot better than what it is now. Yeah, definitely.
Yes,
happy to get rid of it. Good. Right.
So if you make yourself comfortable on here...
Do I need shoes off?
You're okay. It's fine. How old's your baby?
Oh, 8 months now.
Oh, how nice. Is it your first one?
No, third one.
Third one? Wow. How old are your other 2?
6 and 2.
Oh, you are busy
Very
lady
busy.
then. Yeah. Are you nervous? Don't be nervous. It'll be all right.
So I'm Susan Towers. I'm a GP, but with an interest in skin problems. That's why it's Sister Eve, wasn't it, that sent you here?
Yeah.
Linda.
Linda.
Okay. She said that you've been having trouble with your face for a few years.
Yeah. It's been after the birth of these twins.
We're blaming them, are we? Yeah.
No, actually, everything was right. Everything was okay. My face was really good. But it's been last 2 years I am having this problem.
Right.
And I am having it just before my period, every month. Sometimes every month, sometimes every other month. Can you see this spot?
Yeah.
All around my face.
Yeah. Is this a good day, is it?
Yes, it's really, really good.
Well, we can definitely do something for this. This is acne, and in some people it does start later on in life. It usually starts in the teens, but in some people who are unlucky it can start in the 20s, 30s, even 40s, and then it's much more stubborn, unfortunately. So sometimes we need to use quite strong treatments. The problem that you've got is caused by your grease glands being too active. They're making too much grease, and the gland itself is getting blocked. Okay. So when there's too much grease in a gland, sometimes you can see it like a blackhead.
Yeah, blackhead, whiteheads everywhere.
Whiteheads, exactly.
Yeah.
And then sometimes the gland sort of stretches and stretches and gets very inflamed and red, and that's those red lumpy bits that you're describing.
Everyone this pop.
Yeah.
Oh my God. Sometimes at night,
Really
sometimes
sore.
in morning.
What I'd like to suggest to you is this strong treatment called Roaccutane, which really shrinks the grease glands and makes them small again. It's the only treatment that does that.
Okay.
One thing that's important is you can't take this if you could be pregnant or planning a pregnancy in the next few months.
No, not at all.
No, not at all.
No.
Because this tablet always damages a baby as it's growing.
Okay.
So that you would be advised to have a termination. So it's really, really serious. Okay, so that's one thing.
Yeah.
It can also affect your mood in some people. It's very important for patients to understand the potential side effects of prescription drugs. It's a bit of a contract between us and the patient. We need to think about whether it's safe for them to take that medication, if there's other things that might interact with it. Most medications are taken safely and without any significant side effects, but if there's some particular medications which we think have a potentially serious risk for an individual, then it's important that we talk about those. Sorry, I just have to ask that personal question again. If you're sexually active, you must use 2 methods of contraception because this medicine so often damages growing babies.
Oh, okay.
But just bear it in mind. And each time you come, we'll need to check a pregnancy test.
Oh, okay.
So don't be upset that we're asking you to do a pregnancy
okay.
test. It's just what we've got to do. Okie doke. So we'll be seeing you probably in 4 weeks.
Okay,
Right.
thank you.
You're welcome. Thanks. Take care now. Bye-bye.
I'm just going to test it. Tell me if this feels sharp.
No, I feel that you touch, but not...
Yeah, nothing sharp. That's fine.
No.
You'll feel a bit of pushing and pulling, and that's
Yeah.
normal.
Yeah.
You know, Tatiana, I'm opening this up now, and it doesn't look like a cyst. It looks like a bit like if you got something in your knee, like a piece of wood or metal. So
Like something inside.
Yeah. Often people get like a little chip of wood or a little chip of metal under their
Really?
skin, and then you can form a granulation tissue around it, and it forms this hard surface like this. So I
Alright.
suspect that's what's happened. And it's in one of those positions where you're likely to kneel onto something, and it...
Yeah, when you touch, it's like little ball inside. You
Yeah.
know? It's not...
It's okay, we'll get it all out. It's not a problem.
You okay?
It's nearly done, yeah.
Is it hurting?
No, no.
All right.
It's all right.
Really doesn't want to leave you, Tatiana.
No, it likes being in there.
It's quite at home here. Right, it's gone. We're just going to put the stitches in and then we're done.
Mm-hmm.
All that for that. You have a nice smooth knee now. You'll have a bit of a bruise where it's been, but it's all gone. And Karen, I'll just put a little dressing over it, and that's that.
I'll just lower
Thank
the
you very
couch
much.
down.
No problem. In a week's time, it'll look beautiful.
Okay, thank you. Thank you.
Hello.
Hi, are you okay?
I'm fine, thank you. Sorry to keep you waiting. How is your dad? How is he feeling?
That medication you give him isn't working at all. So we've had a lot of down days. He don't go out or anything now. He's just enclosing himself in house.
Okay.
So from last time we seen you, it's just got worse.
Okay, he doesn't want to leave the house.
Yeah, he tries to enclose himself.
Okay.
He's fell more into depression and anxiety and
Okay.
feels more worthless.
When you say worthless, is he trying to harm himself?
Yeah, we had to ring first response unit and they said they're going to send him an appointment out.
About 4 times a day they're ringing.
Yeah, they said they're going to send him an appointment out for mental health team because he needs to be assessed. But I told them we had an appointment with you today and they said that it'd help if you could refer him to mental health team as well.
So they want me to
Yeah,
refer
as
him to
well,
the
yeah.
mental health.
Yeah.
Okay. Do you feel like harming yourself?
Not right now, but you never know, do you?
Okay.
Anything could just trigger it. It's what goes on. It's what the voices he's hearing in his head and stuff.
Come in. Right, so which one's Hardy?
Hardy's this one.
Yes.
He had been diagnosed with hand, foot and mouth.
Yeah.
So that's...
How is he doing after that now?
He's
then?
not been too well, you know. It's, it doesn't seem to be picking up. And like his mouth is always sore. And it's still like, I can see a few spots in there.
So is he eating and drinking?
He's not back to his normal pattern of eating and drinking
Yeah.
since the hand, foot and mouth.
Yeah.
But when he does eat, sometimes he'll complain like, ow, that hurt.
Okay. Did he have any ulcers or any skin problems anywhere else when he had this?
He had some spots on his
What
hands.
about
They've
his
all
feet?
cleared up, and on his feet.
And if that's all
There's
better
one
now?
little scar left,
Yeah.
but it's all cleared up.
Can you take his top off for me? Hardy, can I just have a listen to your chest, sweetheart? I know it's not nice coming to see the doctor, is it? Good boy. His chest is lovely and clear. I'm just going to check his temperature quickly. I'm just going to pop this in your ear, sweetheart. It shouldn't hurt. That's perfect. Can you open your mouth for me, darling?
Go ahead.
Ah. Ah. Stick your tongue out, like really naughty. Be really naughty and go,
How do you go like this? Good boy.
Ah.
On that side as well, I saw the spot. Don't know if you can see him now.
I'm going to put my finger in your mouth for 2 seconds. Try not to bite my finger off, okay? I need it for work. Can I just have a feel, my darling? Does that hurt?
Where does it hurt, Hardy? Oh.
That's fine. That's good because he opened his mouth. He's got a tiny, tiny ulcer in the back.
Is it just
yeah.
the one?
Just the one that I can see. The throat doesn't look inflamed or anything. I can't see anything that worries me. So it can take a bit of time for these ulcers to get better, especially the ones in the mouth. Have you tried to use anything?
Bonjela.
Yeah, and is that helping?
Not really.
It's the only thing that we can really recommend for kiddies that age. You probably know this already. So I'd advise you to carry on using that Bonjela. But if he's still not right in the next couple of weeks, then just bring him back.
Okay.
They're all very good, your kids, aren't they? Is it an act?
A cover up.
What do you want me to do for him today? Because I can speak to the first response, okay? If he's feeling suicidal,
I think what we need to do is possibly if you could refer him to mental health team for mental health team to assess him personally rather than on a form.
Okay, I can do that, okay? Are you happy with that? Yes?
Yeah.
Okay. Will you be there for him?
Yeah,
and will
there's
somebody be on
family's
him?
watched all the time, yeah.
I hope you understand the
out,
reason I'm asking
Yeah,
this. And we need to see him again after about 4 to 5 weeks because we are increasing the dose for him.
Yeah, that's fine.
Reasonable?
Yeah.
So we'll see him and I will refer him to the mental health team as well. Happy with that?
Yeah. Yeah.
You agree with that?
Yeah.
Yes?
Yeah.
Because he doesn't talk much.
Because he's really low. We can't let him have sharp objects around just in the kitchen to cook just in case because he gets things in his mind and stuff.
So we'll just do what we have planned?
Yeah.
Is that okay?
Yeah, that's fine.
Is that? Yeah? All right then.
Okay.
All right
Thank
then.
you very much.
Thank you.
Thank you. Bye.
You like doing this? Is this a geeky thing that you like to do?
No, I like doing that as well.
It's quite
therapeutic.
Yeah. So there's 4 number of scripts and 4 on each thing, that's 16 in it. What's 12 times 4?
12 times 4. 48.
If you wouldn't have been here, I'd have used calculator on there. I would have been like that.
Bless you.
Hiya, come on in.
Hiya.
Medication review, that right?
Yes.
And how are you feeling in yourself?
Okay.
How many do you smoke then?
I don't know, it varies. When I'm working, I don't smoke, you see.
Right.
Obviously, can't smoke in work, but I do.
What's your
obviously, when I
job?
get lunch. I work at warehouse at distribution centre.
Right.
I used to work somewhere else, then I got sacked, so.
All right.
But that really dusty atmosphere in me.
Made your chest worse, did it?
Made my chest worse. Yeah. But this is dry.
Okay. So your blood pressure's up a little bit. You see that you'll always be a smoker?
Probably.
Yeah.
To some degree.
And do you know why we'd like you to stop smoking?
Because of my chest, I know.
Have you tried to stop?
Not really.
No. Can we give you some help to stop? To try to stop? What do you think? And what would get you to that point where you think, I'm going to have to stop now?
I mean, if my chest got that bad.
Yeah.
Like, no.
Yeah. But if we know your chest will end up that bad, if you carry on smoking.
So I should...
and it usually takes
stop.
people, average about 7 attempts to stop. So you've just got to keep trying to stop. And the message really is that if you don't stop first time, doesn't mean you'll never stop. just keep trying to stop. Right, my suggestion is just maybe start you on one blood pressure tablet and come back and see me in about 3 to 4 weeks, and then we'll make sure that you're okay on that tablet. But I'd like your blood pressure to be a bit lower. Is that okay?
That's fine.
And do come back and see me.
Yes.
Yeah.
Don't worry, I'll come
Don't
back.
sleep in.
I won't sleep in, I never sleep in.
That's all right.
Once my alarm goes off, I'm up.
And have a think about a few of the things we've just been chatting about.
I will do.
And then we'll set up a plan for the future when I see you next time.
Right, okay, thank
Cheers. You take care.
Yeah, you too.
See you, Paul.
Okay.
Pauline. Sorry, I was in the ladies. Is it working? Sorry. Yeah. Oh, yeah. Oh, yeah, I was in the ladies, so I didn't get it. Sorry.
I'm putting it back. Right, I've got
student again.
Supreet here, a doctor,
Oh,
one of our new
hello.
doctors who's just learning the ropes.
Oh, bless you.
Right. Pauline.
Yeah. First, there's two things. First one, say that still going really well with the tablets. I still feel anxious, still not sleeping well, and I still get moments of just feeling numb. I don't know, I just need advice.
So at first, when you first started the tablet, they helped?
Yes, they did.
They help with
yeah,
the
for the
sleep.
first couple of nights they help.
The fact that you have noticed a positive difference is really good, because usually we say allow it 4 to 6 weeks.
Yeah, so it's been 4 weeks I've been on them now, I think. Still not getting off straight away, but then when I do go off, I have a really good sleep, so that makes a
that
heck
must
of
make you
it.
feel
It does.
better.
It's wonderful. The other thing, I've got ulcerative colitis, and I don't know if it's a coincidence, but 2 weeks ago I had a colonoscopy, and since then my tummy just hasn't been right. I've had constant diarrhoea. I spoke to the IBD specialist nurse, and I went to the hospital Monday, took up some stool samples, and they took some blood samples. Still haven't had the results of those back yet.
So before the colonoscopy, they'll have had to give you some bowel prep, won't they, to clear you out? I wonder if it's that then that's sort of aggravated
yeah,
things.
exactly. But it's never. I've had quite a few colonoscopies, obviously, and I've never reacted to it in this way before.
No.
And
That
it's
was
just coming
sensible.
out of me like sludge,
Yeah.
really. You know, it's just not formed at all. The problem is, I had to come home from work last Thursday with it because I just couldn't work. I travel on the bus, I don't drive, so of course
It's
I can't.
access to the toilets. It's not pleasant, is it?
No, that's the thing. I wouldn't dare go for the bus because you know it comes on urgently and I have to go. So really, I need a sick note, please, for another week, just to hopefully get some results back and get back to something like normal.
Of course, we'll give you a
Thank
note.
you.
Yeah.
It's just never gone on this long before, you know. It is what it is, isn't it? Unfortunately, there's nothing I can do.
You did the right thing by phoning the nurses, so hopefully they'll pick your message up and they should have the results back by the end of today.
Yeah, hopefully, yeah.
I mean, I know they're busy, aren't they? But
That's lovely. Thank you for your time again today.
All
Much
right then, no
appreciated.
worries.
Thank you.
Take care.
I will, and you. Bye-bye.
Bye-bye.
Bye.
My mum wants to get a dog. I said, who's going to look after that?
So I've just got a dog and he's only 7 months. Labrador, yeah. They're just greedy, aren't they?
How's your little doggy?
He's all right.
Oh, have you got enough in now?
No, he's been a little bit naughty this week.
Oh.
I smell something right weird. Have I stepped in?
Oh, my first ever picking up dog poo experience, which was quite a big thing, really, the first time. And he did a poo on a bramble, a sloppy poo.
It's not me, is it?
But there was someone behind me, so I couldn't ignore it.
I'm funny.
Coming in. Hiya, Mr. Russell.
Yeah.
Hi, it's Dr. James. Nice to meet you.
Oh, I've sat down enough. I've sat down enough. I can't
Do you want to stay standing up?
Yeah, if you don't.
That's fine. Yeah, I'm cool with that. How can I help you today?
I've had a crick in my neck,
Yeah.
but I've also got a bad back.
Right.
I don't know what's happened. I took my dog. I went up to hospital a couple of weeks ago because my dog went through my legs and dragged me over. I'd badly sprained my leg. It was in that much pain I couldn't walk on it. But I didn't mention my back, but my back's just got worse and worse and worse, and it's really sore and I can't sit down.
And how long ago is it now?
About 5-6 weeks.
Oh, right, so it's quite a long time.
It's quite a while ago.
So can you show me which point it's most tender on?
It's mainly this part here.
Okay, I'm just going to gently feel down the middle of your spine first.
Just there.
Okay. Is it there as well?
Yeah, that's it.
Sorry,
That's one.
sorry. And you're able to just lay down on the couch here? Now just let me know if you feel any pain. Right, where's that?
That's just a box.
The bottom there.
Bottom.
About this side? Same place?
Yeah.
I'll let you jump off then, just nice and slowly. Jump off's the wrong word. Just gently step up.
So when I breathe as well, that hurts.
It's all spasmed up, isn't it? And what your body does in response to any pulling injury on your back is it thinks, oh no, that's my back's important, I need to keep it stable and the muscles go really tight. It's almost a bit like a whiplash injury, you know, when you jerk forward and then you get really stiff neck. It sounds like the injury you've had is a bit similar like that with the jerking with the dog. So we could use an anti-inflammatory and that would help bring down some of the pain and some of the tightness a little bit. And then the other thing is, what do you think about seeing a physiotherapist? Is that something you'd be interested in doing?
Yeah, I'll have to do.
There's a drop-in physio here on a Wednesday lunchtime. You can just come in and see, and they'll give you like a one-off kind of work over and give you some exercises. There's your prescription. Okay then.
Cheers.
Take care now, yeah. All the best. You're all right with that. Take care now.
Thank you. See you later.
Bye now.
Bye-bye.
Come in. Oh yeah,
Good morning.
Raymond, come on back. How's things going?
All right as such. The rolling pains have gone, but I've still got bad stomach ache. I noticed about a month ago when I went to toilet to poo,
Yeah.
the water was turning an orangey colour. And yesterday when I went,
Yeah.
there were some streaks. I don't know if it's blood or not.
Right, okay. And are you going to, when you go to the toilet, are you going more often or is it just once
No,
a day as
it's
normal?
twice a day. I usually
Once
go
or
twice a day, and
Okay.
usually first thing. in
And
the
how's your
morning.
weight doing?
All right, as far as I know.
You
I don't think I've
You don't
lost
think
any.
you've lost any
No.
weight or anything?
No.
And we've got your blood due today, haven't we?
Yeah, I am had chance.
I know, it
today,
don't matter, so-
with work, I am had chance. To
Well, I think the
go.
fact that you think you've probably had some blood, I need to examine your bottom end, if that's okay.
Right. Yeah, no
And
problem.
then that changes the position a little bit. We might end up referring you for further investigations.
Okay.
So do you mind if I do the bottom
No,
end?
no,
That's great. So if you just have a lie back on there for me.
I'd not thought anything about it. I just thought it was me poop turning water.
Yeah.
It's not clots of blood or anything like that. It was just with me noticing it being streaky yesterday.
Yeah. So what you'd need to do is probably just undo your trousers and your underpants and then turn over onto your left side and lift your knees up to your chest. Is that okay?
Yeah, that's no problem.
Great. I'll just get some gloves on. You had this done before?
No.
Looking forward to it? Nobody's ever said yes yet.
No.
There you go. Great stuff, that's us finished. Just hang on a second, I'll get out of your way. I think the fact that you've got this ongoing grumbling abdominal pain and the fact that you've noticed probably some blood, we ought to refer you on for bowel investigations.
All right.
Because that means having a look at the bowel all the way around, up from the bottom end.
Right.
And what we're thinking about is making sure there's no polyps. So these are little growths in the lining of the bowel that can bleed.
All right.
And sometimes those polyps can be early signs of cancer in the bowel.
Yeah.
And that's the thing we want to be picking up
Right.
and making sure that we're not missing. So even though it may well all come back all normal, I think it's the
Yeah.
right thing to get on and get those
No problem.
investigations done. Is that all right with you?
That's fine, yeah.
Right, we'll make arrangements for that to happen. What they'll generally do is a colonoscopy examination right round the bowel,
Right.
make sure it all looks clear.
Okay then.
All right.
Thank you very much, and thank you
Okay,
for
nice
your time.
to see you again. No, don't
Thank
worry,
you.
Raymond, thanks. Well, I'll just walk you down to get your bloods because Jess is waiting for you.
All
We
right.
can get you
Oh.
sorted out in one go, can't we?
Yeah, sorry.
Yeah, you follow me.
Sorry about that. I had to
Sorry,
go and
that-
review a patient next door.
Absolutely fine.
Right, so I'm Dr. Khan. How can I help?
What it is, I can't walk on my heel on my right foot.
All right, yeah.
Don't know what I've done.
So I thought, I'll leave it a couple of weeks, I'll take some anti-inflammatories, get it down, and it hasn't gone.
Yeah.
I've had ice on it, everything, nice baths, no taking it down.
Let's take a look. So show me where you get the pain.
Just right in that area, just in that full area there. So every time you touch it, it'll hurt.
Yeah. And just remind me what you do for work. You say
I'm a drainage operative.
Are you on your feet a lot?
All day.
Yeah.
All day long.
Okay. So I think you've got a condition called plantar fasciitis. Have you ever heard of that before?
No, never.
Right. So let me just show you what I mean. So this is the plantar fascia, that lining of tissue that runs under your foot.
Yeah.
And that's the bit that can become inflamed.
That's what's hurting me.
Yeah, yeah. And you can see it's exactly the place where you're getting the pain, really. So you've done the anti-inflammatories and the resting side of things. The next step is really trying to get that more elastic again by doing some exercises, which I'll show you. If the exercises with the painkillers don't work, the other option is then to think about injecting it with a cortisone to try and loosen it up, which is a really powerful anti-inflammatory.
Okay.
So you can see these pictures here.
Yep.
We have to stretch it out, really. So you lie down with a cloth, lie on the floor, and you pull your toes
Pull your
back.
toes towards you.
Because what that plantar fascia links into is the tendon at the back of the heel as well. So, say this is the foot that's the problem.
Yes.
And you pull in there, and what you feel is a stretch all along there.
So
and
basically all you're doing is stretching your calf muscles.
yeah, because you want to pull it up, really.
So that, yeah, okay.
The other thing is this. This is a really good one, but you use a tennis ball rather than a rolling pin.
Yeah.
And you just roll your foot back and forth over a tennis ball. And if there's any
Like a
inflammation-
massage?
Yeah. The thickened bit will start to break up and then soften. So I'll just print this off for you.
Brilliant.
It's a really common condition, so don't worry about
I
it,
won't
and it's
worry.
easily treated.
Right, thank you very
All
much,
right.
sir. Yeah,
Okay,
cheers.
thanks for
Ta,
coming in.
thank you.
Cheers. Take care.
Janet thinks I've lost a pound. And see how I've been trying this week, really.
That's good then.
That's all right, isn't it?
When you've lost a pound and you've been really good, you're like, a pound.
Yeah.
But then when you might been that good, you're like, a pound! Like, it's never acceptable.
I remember I went and I'm like, I've had a really bad week and I'd lost £6. I'm like, has your scales got problems?
What? That's never happened to me.
I have no idea what were going on. How did I do that?
How have you been? Good. Come and take a seat. Last time we weighed you was November 2017. You were 13.10. You're now 12.11. So
Wow.
stone off. Is it anything to do with cake?
Yes, I have stopped baking.
So you've had all your bloods done for your diabetes?
Yep.
How do you think you've done?
Well,
Okay.
because I'm very careful.
Okay. Your sugar now.
Pre-diabetic.
Yes. 39.
Nice.
Yeah. Cholesterol, 2.5, excellent. Kidneys, excellent.
Good.
You're getting a gold star.
Ooh.
Right, you're on a lot of tablets, aren't you? Losartan for your blood pressure. Lanzoprol for your stomach. Bisoprol. Amitriptyline. Yeah. Sitagliptin for your sugar. Olive oil for your ears. Pregabalin.
For the pain, joints.
Yeah. Laxido.
Yep.
Constipation. You've got inhaler. Fibrogel. Ibuprofen. Manivec. Torvastatin for your cholesterol. Mebeverine for your tummy. Mood tablets.
Yes.
Okay, so we might need to take a tablet out. I'm just doing yours now. Please stop glimepiride 2 milligrams as hypo risk. And excellent diabetes control.
Ooh, I'm gonna go eat all the ice cream I can find. No, I'm kidding.
Did they ask you to bring a urine sample?
No, I keep forgetting also.
Okay. If I give you a bottle and a form, will you be able to do it?
Yeah, I'll be able to bring it back.
All you need to do,
just put it.
Leave them in there, put your urine in there, drop it back at surgery.
You.
Oh, it's lovely to see you.
Yes, and
Everything's
tell your
really
boy
good.
Happy birthday for me.
I will
The
do.
best people are born on our birthday.
So let's see you before your birthday, yeah?
Okay.
Kidology.
Next year.
Yes.
Wow, a whole year.
Yeah, a whole year. If you find that sugar starts to creep up, come back sooner.
Yeah.
But I think you're going to be fine.
You look after my
And you.
Peter for me.
See you later.
Yes.
I'm on TV. Bye. Go that way.
Oh, okay.
Bye.
Bye-bye. Let me get the dog for you. Bye-bye.
Cheers, mate.
Take care. Bye.
It's nice meeting you, love.
Nice
and
meeting you too, honey.
Have a good life. Stay as you are. Thank you.
You too.